Respected Regional Secretary Health Niti Ayog Dr. Rakesh Sarwal, respected Secretary Health Government of Jharkhand Dr. Nitin Kulkarni, respected Honorary Brigadier Dr. Arvind Lal, Executive Chairman Dr. Lal Path Labs Limited, my doctor colleagues and audience watching us from all over the world, a very, very warm welcome to the conclave. This is Dr. Naveen Nishchal and I am your moderator for this session. Today is indeed a special day for doctors. We are celebrating the day in honor of one of the biggest legends in the space of medicine and healthcare, Dr. Bidhan Chandra Roy, or we know him very oftenly as Dr. B.C. Roy. He was a physician with incredible gift for diagnosis. In every part of the world, we have been witnessing the tireless and selfless manner in which doctors have been turning night into day, fighting the pandemic to keep humanity alive. We must ensure that inspiring stories of courage and sacrifice of these doctors reach the community at large. The world needs to know, recognize, and remember the incredible journey of every doctor through times of peace and war. We are all doctors on this panel, and I'm sure you will echo my sentiments here. Becoming a doctor has never been an easy task. You need hard work, dedication, passion. You have to be ready for sacrifices. Right, beginning from getting admission into medical school, going through those tough 5 years of study, practicals, preparing for exams. None of those challenges were easy. And if you add further study into it, like post-graduation and super specialization, it makes it more rigorous. I remember while doing my MD medicine, doing non-stop 72 hours duty was the usual routine. And I remember I have missed a lot of festivals and many family and social occasions. I was not present in those occasions. But when I look back at what the profession has given me in return, I feel every drop of step was worth it. And I'm proud to be a doctor today. But today, I don't see many families wishing to send their kids to become a doctor. They don't want to invest so many years of their life in studies, 5.5 years of MBBS, 3 years of post-graduation, and if you wish to pursue AM or MCH, then you need to add more years into this. And by the time you are ready to start your practice, 12 to 14 years of your life are gone. So family today find other professions a more efficient investment of money and time, since they bring in greater financial returns and better quality of life in short span of time. I think we need to create more avenues to motivate youth so that they choose to become doctor. Having said that, here are my 2 cents for today's doctor. Firstly, we have to change with changing time. the way medical science is changing and improving, we have to take our doctor and patient relationship to the next level. We are living in the time of customer first, and here comes the patient centricity. There was a time when patient was ignorant and didn't know anything about medicines, treatment, diagnosis, or procedure. And doctor used to decide various treatment modalities for the patient. And as a result, doctor had a power to do whatever best can be done for the patients. But today, patient is smart, want to be the part of the decision making. However, I think doctors are still caught up in the traditional mindset zone and reflexively programmed to make independent decisions. In my opinion, we have to open up, be interactive with our patients, take the patient into confidence, and turn the patient into an important stakeholder in decision making and medical outcomes. In patient-centric approach, patient is not just recipient of care, but sits right in the center of the value chain and care ecosystem. We must honor and justify this new status and role of the patient by empowering these patients with relevant knowledge and data. When patient and family are part of the decision-making process, the adherence and compliance to the treatment also increase. Secondly, with my experience, I would like to speak about technology adoption. I think doctors have not just doctors have to not just adopt technology but embrace it as a key enabler. Oftenly, doctors carry a perception that technology is not going to help them in medicine, and they think that they know best about medicine. I agree that technology cannot replace human-centric, human instinct and insight, but I also believe that technology always complements and augments the human ability. Why fight the battle alone when
Looking back at the curriculum of health Doctors have traditionally been put.
Change with changing time. The way medical science is changing and improving, we have to take our doctor and patient relationship to the next level. We are living in the time of customer first, and here comes the patient centricity. There was a time when patient was ignorant and didn't know anything about medicines, treatment, diagnosis, or procedure. And doctor used to decide various treatment modalities for the patient. And as a result, doctor had a power to do whatever best can be done for the patient. But today, patient is smart, want to be the part of the decision making. However, I think doctors are still caught up in the traditional mindset zone and reflexively programmed to make independent decisions. In my opinion, we have to open up, be interactive with our patients, take the patient into confidence, and turn the patient into an important stakeholder in decision making and medical outcomes. In patient-centric approach, patient is not just recipient of care, but sits right in the center of the value chain and care ecosystem. We must honor and justify this new status and role of the patient by empowering these patients with relevant knowledge and data. When patient and family are part of the decision-making process, the adherence and compliance to the treatment also increase. Secondly, with my experience, I would like to speak about technology adoption. I think doctors have not just doctors have to not just adopt technology but embrace it as a key enabler. Oftenly, doctors carry a perception that technology is not going to help them in medicine, and they think that they know best about medicine. I agree that technology cannot replace human instinct and insight, but I also believe that technology always complements and augments the human ability. Why fight the battle alone when doctor plus technology can make a powerful team? This is the reason behind it, because we are not taught digital health in medical colleges. Here in this session, we have expert from Niti Aayog, Dr. Rakesh Sarwal is here. I will take the liberty to request you, sir, if at policy level digital health can be taught at medical colleges, I would request you to introduce something about digital health in medicine curriculum. Although West is adopting technology and replacing and reaping the benefit, we are still acting as laggard and defying technology. It is the time we move forward with changing time and evolve the doctor profession, not just treatment driven and empathy first, but also cutting edge and future ready. Before I end my address, I would like to thank all the frontline warriors, unsung heroes, those who are risking their lives along with their families. My sincere gratitude and big salute to them. Thank you very much. So moving forward, I would request now respected Honorary Brigadier Dr. Arvind Lal, Executive Chairman, Dr. Lal Path Lab Limited, to share his thoughts on today's topic. Over to you, Dr. Lal.
Thank you very much. And I would first like all my fellow doctors a very happy Doctors' Day. And I especially thank Dr. Naveen Nischal and Voice of Healthcare for organizing this Doctors' Day conclave. I also welcome Dr. Rakesh Sarwal, Dr. Kulkarni, and the other esteemed members of the panel for being here today. Thank you, sirs. So let's start with our medical profession. It is considered a very noble profession, as you all know. And in our Indian culture, a doctor is often endorsed as God in human form. Doctors have traditionally been put on a very high pedestal as leaders and role models by individuals, communities, and society. People look up to their doctors for matters of their health as friends, philosophers, and guides. From my own personal experience, I can share with you that there have been 3 instances in my life when people who are not related to me have put their trust and faith in me to an extent that I was asked to be a witness in family matters like the signing of a will or distribution of property. This happens because doctors have been known to always stand by what is right and not what is convenient. We always go with a straightforward and scientific approach, even for matters outside the scope of medical practice. Having said that, in the challenging environment in which we deliver healthcare today, we must remember that in addition to training our young doctors and medical students to become good practitioners, we should also be training them to become healthcare leaders and even entrepreneurs with great business minds. It is a fact that a large number of hospitals, I should say private hospitals in India, are owned by doctors. It is also a fact, Dr. Nischal is one of them. It is also a fact that pre-COVID financial assessment of hospitals indicated that only about 10% of hospitals were profitable and financially sustainable. In spite of demand for healthcare being so high in India, hospitals and are underutilized. Therefore, beyond their clinical expertise, doctors should be trained also in effective utilization of available resources, controlling of costs, managing teams, running hospitals, and basic management skills. I envision that the role of doctors in the health system post the pandemic is going to be only further accentuated. We will witness these in the responsibilities and participation of doctors in key health related policies and decisions. This should be used as an opportunity by passionate doctors to be a part of the healthcare reform that is long due in India. One such area where we can make a significant difference is in resolving the stark urban and rural divide in access to quality healthcare in India. It will not only ensure equitable access, it is what was highlighted long time back by our Indian management guru, late Professor C.K. Prahlad. He defined the challenge as selling to the poor and helping them improve their lives by producing and distributing products and services in culturally sensitive, environmentally sustainable, and economically viable ways. What we used to call that there is value even at the bottom of the pyramid. That's what we are talking about. So, according to Professor Prahlad, C is equal to 1 and R is equal to N. So don't worry, it's not an Einstein's theory. Where C stands for one consumer has to be serviced at one time. And R stands for resources which have to be put in, to service that customer, and N is N number of resources. So it's like a funnel effect. You put all your resources to service that one customer. You have to engage in this if you want, every patient to go back happy. We as doctors need to create a valuable proposition in rural healthcare. The government should support this endeavor with better salaries and facilities for doctors who are willing to work in rural settings. Currently, there is a lack of healthcare infrastructure and resources, including shortages of essential medicines, diagnostics, and very limited career prospects and scope of development with support services for doctors and their families, like proper housing facilities, school education, recreation, etc. Along with greater responsibility, doctors should be given greater recognition, support, as well as their own security. To increase the prosperity of India, we must look after our own doctors. In our ongoing war against COVID-19, we have lost more than 1,500 doctors in India. Personally, I have lost 5 of my classmates who were doctors. The government and the society must recognize the sacrifices made by doctors who have always put service before self. Instead, we have been constantly hearing of cases of violence against doctors and other healthcare workers from across the country. These instances have increased so much in recent years that it can be termed as an epidemic for the health system. This is totally unacceptable. As healthcare leaders, we must against any form of violence, verbal abuse, or vandalism and physical threat or assault to us doctors and our fraternity. An active role must be played by the government of India and the media also. The government should punish unlawful behavior of anybody who harms the doctor and vandalizes a healthcare facility. Recently, a new epidemic disease amendment ordinance has been brought in regard to protection of healthcare staff. Additionally, there is the protection of medical service persons and medical service institutions, that is Prevention of Violence and Damage of Lost Property Act 2017, also known as the Medical Protection Act or MPA, currently implemented in about 23 states. However, there are concerns over implementation of the legal provisions at the right levels to provide support to the doctors. What we need today is a 100 type of an emergency hotline number in police to report and get immediate assistance on acts of violence against doctors and other healthcare workers. At the end, I would like to say that doctors always play a leading role in healthcare and are considered to be ultimately responsible for the overall outcome of patient care. We are automatically the ideal role models, whether we like it or not. Therefore, this Doctors' Day, in addition to merely paying tribute to doctors, that is the everyday heroes, let us pledge to support each other, our young doctors and medical students, as their leaders and mentors to drive the medical fraternity towards greater heights. Thank you very much.
Thank you very much, Dr. Lal. And you rightly pointed out that we should have doctors at not only at clinical level, but at policy level, at executive level. And we are fortunate enough to have Dr. Sarwal and Dr. Kulkarni. Both are doctors and both are at policy level, working at policy level and executive level. But we need to think beyond this also. I think Dr. Sarwal is the right person to comment on this. We will listen to him very soon. And I agree that violence against doctor is a it's sort of an epidemic, and we have to work around this. I mean, we can't accept that those doctors who are working day and night, they are being affected by this violence. So we need to work around this as well. But before I would request respected Secretary Health, Government of Jharkhand, Dr. Nitin Kulkarni, to share his thoughts. Over to you, Dr. Kulkarni, please.
Thank you, Dr. Naveen. At the outset, I must thank Voice of Healthcare for organizing this panel conclave. Because of the situation prevailing, we are meeting online mode. And I must wish all the doctors a very happy Doctors' Day. Every year we celebrate Doctors' Day. It has become a sort of ritual, like there are a number of days, so Doctors' Day is also one of them. But I think this year's Doctors' Day is a bit special because of the special circumstances we are witnessing. Here, our doctors and the entire medical fraternity is working for the last 18 months, day in and day out, just to save the lives of the patient and fighting against a disease which was earlier never heard of. We never had any templates or prescribed treatment for all this such type of pandemics. Our health systems are also not designed in a way to respond to such situations the way it may be redesigned to. But still, without being worried about their own families, worried about their own safeties, the fraternity has risen to the occasion and provided an excellent example of a humanitarian service. As Dr. Lal rightly mentioned, that more than 1,500 doctors lost their lives during the 2 days. Only in second wave, as per IMA figures, we lost about 719 doctors. And some of them were very leading names in their fields. So that's a great loss, as an intellectual loss to the country. And I think on this day, we all remember the dedicated services offered by the doctors, and we should also be paying our gratitude and sincere tributes to all the doctors who lost their lives. Dr. Naveen rightly pointed out that nowadays many people are not ready to take the medical education as a leading profession. The basic reason, as I keep on interacting with kids number of times, I find that they are not ready to spare lives 5 to 7 years or at a time 9 to 10 years, in fact, to get into this medical profession, complete the specialization and super specialization. Also, that because of our admission systems, most of the students have to stay away from their homes for a long times during this period, and that is also one of the major reasons that we are not able to attract some fresh students to this medical education now. And I think with passing time, the demand for medical seats is also going down as it has happened with the engineering seats. So there is a very strong case of looking back at the curriculum we are offering to the medical students, maybe concise it to say 4 years or reduce it by some time. And also there is a need to reorient that entire medical focus from purely curative side to preventive side as well as to the research side. Right now, when this pandemic hit us, medical research was one field where we were found wanting on most of the occasions. We were relying on some other data. However, we picked up very quickly, but that initial gap was there. So I think medical research is one area where many students will like to be joining, but because of our systems, it is becoming difficult for them to join. I fully agree with Dr. Lal when he said that there is a strong need for inculcating digital medicine and the digital practices in the curriculum itself. And not only this, basic communication strategies and management strategies. And I think COVID has actually changed the perspective of the community as well as the medical fraternity towards each other. So now people are not looking to you as just a plain service provider or a plain healthcare provider. They want a sort of holistic package, a comprehensive package. They want you to be available 24/7. They want you to be in a situation where night 3 o'clock they can call you and get some mental solace at least of speaking to a doctor and getting some medical advice from him. The mental aspects of COVID, I think they are causing more damage to the people because post-COVID, the mental issues which have cropped up among the most normal population and many people who never had COVID but seen the COVID or because of this infodemic on social media, they had the occasion to read through and develop some wrong notions about the things. I think they require real help from the medical fraternity. As you rightly said, medical profession has evolved over time. I can still recollect the 90s when we were medical students and the present day medical students and the doctors also. There is a very strong case for people to really keep up with the evolving technology, number one, and evolving practices throughout the world. Technology is enabler. Technology is there for handholding. It will never replace a doctor. So one should not get taken by it. Many people, I was attending a webinar where the topic of webinar itself was whether artificial intelligence will replace some of the at least fields in the medicine. So one need not be fearful of it because this is one profession where you can always have a lawyer or a CA work being done by artificial intelligence. But unless you personally get attended by a doctor, no person can get the treatment which he desires. So unfortunately, that personal touch and that trust and faith is getting eroded to an extent. One of the major reasons is the lack of time between, this absolute lack of time for the doctor as well as for the patient. In fact, the last study which is available, the average doctor spends less than 2 minutes in India in the OPD setting. So obviously this patient is not satisfied with the services and quality of services are getting affected. So these patients are going to the pharmacist, trying to understand whatever is written on it, and then they are obviously getting some different various opinion. So we really need to work on this trust formula and improve our communication with the patients. This COVID has shown doctors in various roles. You have number of examples where the hospital, foremost doctor of the hospital, handled a crisis situation at the night time where suddenly a surge of 20, 30 cases came and he managed them very well. You also had opposite scenarios. And I am not to be boasting of the profession, but I have seen this at IAS officers working as collectors with medical background or in the secretarial positions, the districts and the states produce better outcomes, at least during first and second week. So there is in fact, I felt very sort of vindicated because number of times one was fed up convincing people that why did you leave the MBBS and join the IAS. But I think this time that policy of having a pool of talent from all across the streams has really provided lots of dividends. So I think the role of doctor is never going to change. One must understand that. It will only evolve. And we also have to evolve because society is changing. Today, when the patient comes to the doctor, invariably you can take it that it is the second opinion. Because the first opinion is already given by Dr. Google. And now this Googleized patient, when he approaches the doctor, he questions the investigation, he questions the treatment. And I fully agree that the now patient has to be made party to whatever treatment is being decided, whatever investigations are being advised. But this can happen only if there is an adequate time available between the patient and the doctor both. So I think only with a proper communication between the two, we can have this situation. We can have this situation. Uh, we must understand that this is not a merely a profession. Yes, obviously every profession gives you money, but kind of social recognition and the kind of social obligations this profession puts on one, I think that's unprecedented. As even working in administrative capacity, when I tried to help some people, actually I did nothing to treat them, but I arranged their treatment. And the gratefulness and the appreciation they had, I think that's beyond words. So this profession will always continue to have this superior edge, you can say, and we need all of us. It's our duty to ensure that this edge remains, and this will only continue through our conduct, our behavior, and our the examples we are going to set for our youngsters to follow. I hope that government will definitely come out with certain good options to ensure that good talent gets attracted to this profession, and we will continue to have a very knowledgeable and skillful pool of doctors, and health tourism, which country is known for, will continue to flourish in future. So I wish all the doctors a very happy Doctors Day, and I'm very proud to be a part of this fraternity. And I always mention that I am Dr. Nitin Kulkarni. I never allow any people to miss my being a doctor. Whether I am IAS or not, but I will continue to be doctor lifelong because as IAS I will retire. So thank you very much. It's pleasure to be part of this. Thank you.
Thank, thank you very much, Dr. Kulkarni. You rightly pointed out certain points, especially technology cannot replace doctors. Technology is always, it can complement, it can help, but I agree that technology cannot replace doctors. But at the same time, I always tell doctors that they have to adopt technology. They have to be tech savvy. Although doctors are not very tech savvy, but I fully agree with you that technology cannot replace doctors. So with that, I would request respected Additional Secretary Health, Niti Aayog, Dr. Rakesh Sarwal, to share your thoughts, sir. Please, over to you.
Thank you, Dr. Naveen. Let me thank the Voice of Healthcare for inviting me for this seminar on the Doctor's Day. I greet my colleagues on the panel, Dr. Arvind Lal and Dr. Nitin. I greet all the doctors who are witnessing this seminar on the Doctor's Day. And I hope that this first Doctor's Day that we are celebrating today after COVID will bring forth new ideas, new collaborations, new insights, and new sensitivity among the public to appreciate the unique role that the doctors played during this pandemic, both as treating physicians as well as socialized physicians and leaders. And I'll come to that point a little later. First of all, about the Voice of Healthcare. I think it's, Dr. Naveen, you have created a very important organization which does the key elements that work in a doctor's mind. It thinks about problems, it's a think tank, it collaborates, and then it finds solutions. It brings all of this in a very, very systematic fashion. And I thank the organization, the Voice of Healthcare, for organizing this today. And you are setting an example of how we should take the profession forward. Now, the leader in whose memory we are celebrating this day, Bidhan Chandra Roy, Dr. Bidhan Chandra Roy, who in 80 years of his life, 14 years he was the Chief Minister of West Bengal. A remarkable life, a remarkable learning, where he was member of both the FRCS and MRCP, both a physician and a surgeon. A man who was of such stature that Gandhiji requested him to become the Chief Minister, and he obliged by becoming, he preferred to be a clinician, which he did continue till the last day of his life. When the last day in the morning, he was treating his patients, and then he sang a bhajan before he remitted his body. So such towering persons, B.C. Roy, stood by the principles of Swaraj, the principles of service, basically underlining that the strength lies in empowering the patient. It's about educating the patient, it's about serving, it's about winning the faith of the patient that the real doctor's worth lies in. And I think this spirit is very important today, all the more important today, as Dr. Naveen rightly mentioned. We may consider ourselves as demigod, but in the changing circumstances where consumerism is gaining ahead, where materialism is rising, monetization is the norm, where the role of the doctor as a part of these cultures, as a part of these norms, is resisted. Doctor is still expected to be altruistic. It's still expected to be unconcerned about their own or their family's welfare, and still be largely service oriented. Now this disconnect, this change in values and this disconnect can be countered by following the values of Professor Dr. B.C. Roy in terms of patient-centered, family-centered care that earlier panelists talked about. And I think it's more important today than ever. Realizing that I treat and he heals, the doctors are merely the agents where the healing takes place by natural processes and the lifestyle of the patient. It is their thinking and practices, ahar, vihar, achar, and vyavhar, the satyavrita, the principles of healthy living are the ones which really treat. So empowering the patient with information, with the right lifestyles, and spending time with them, as has been mentioned, knowing them fully, knowing not just the disease, but the patient. A good physician treats a disease, but a better physician treats the patient, treats the person holistically. So knowing the family, knowing the history, and knowing the conditions and the circumstances within which the patient come is something that will build the connect and help the doctors navigate the present requirements of the system. Now, the role that the doctors played, the sacrifices that they made, even to the extent of the ultimate sacrifice of losing their life, underscores the point that doctors are committed to follow the basic values that have been taught to them during the medical curriculum, which is patient above self, the Hippocratic oaths, the ethical principles of beneficence, non-maleficence, autonomy and justice, and the empowerment and the precise nature of their eyesight, of their touch, their thinking, which is developed during medical curriculum, the calmness, the coolness with which we are taught to deal with all circumstances. So these principles, it is time to remind ourselves that using these principles, I think we need to connect better with our patients. And the point that I bring in here is doctors should see themselves as leaders of the society. Doctors are not just the leaders of their medical team, of their paramedical team, but doctors are uniquely trained, both in terms of the rigor of their training, in terms of their mental makeup, to behave, to think of the leaders of the society, their agency, because they are trained to look at a systems perspective of things. You look at a patient, you look at the symptoms, you do the investigation, you do the differential diagnosis, and then you do the treatment and then the follow-up. So the whole thinking is trained in a problem-solving perspective. And this thinking can be applied not just to the patient, but to the system. So if a doctor thinks of a system, the healthcare system, our society, and our polity as something that needs to be diagnosed, that needs to be addressed, then I think very beautiful insight can emerge in the doctors. Beautiful solutions can emerge not only for the healthcare system, but for the larger society. And I think there arises the role of a socialized physician. The idea of a socialized physician who, like Dr. B.C. Roy, who rightly understood what society needed and served West Bengal for those difficult 14 years. So I think in similar line, there is a huge role for family physician, the general physicians, the general practitioners, the GP culture, instead of the super specialization where we are moving today, because that is what will connect us to the person approach, to the entire family, rather than developing super specialization in a particular system or a subsystem. I think we need to all, even if we are super specialists, we need to think ourselves as first human beings, then a family physician, and then as a super specialist. I would like to share with my colleagues here, doctor colleagues, that the 15th Finance Commission has recommended Indian Medical Service on the lines of the All India Service, IAS, IPS, and Forest Service. The Indian Medical Service, when it takes shape, will be a central and a state service to man the top positions in the healthcare sector in centers and states. I think that will really make a difference, because I feel the doctors, as I mentioned, are uniquely qualified to play roles as a leader, and they should think similarly. So again, saluting the service that the doctors give, saluting the teaching that our teachers gave us, the training of the mind and the rigor and the hard work that was taught to us, saluting all the efforts and all the leadership that the doctors are providing, like Dr. Arvind Lal in entrepreneurship, and other numerous doctors who will be coming on this panel today, saluting all that effortless and remarkable service to the nation. I thank all of you and wish all of you the very best. Thank you very much.
Thank you very much, sir. Thanks for sharing your thoughts. I have noted down some powerful words you said: empowering patients, winning faith, achar, ahar, vyavhar. So I think, and X, like, leaders of society, socialized physician, this term I have heard for the first time. So I think these are, wonderful words you have, mentioned. And I think if doctors, today's doctors, if they, adopt all these things, I think we can, serve our country better. So thank you very much. Let me thank all of you from bottom of my heart for adding your unique set of experiences today and for making this conclave shine brighter. With this, we are moving to our next session. Thank you very much. We'll see you again very soon. Thank you very much, sir. Thank you.
Thank you.
So a very good morning to everybody on this National Day's Doctors' Day Conclave. It couldn't be at a better time. We are now 18 months into COVID. A new relationship has been developed between society at large, government, and doctors. We have an extremely distinguished panel who are right in the helm of affairs, dealing with people as well as regulators, to be able to address what is a trend. So earlier, this trend was worrisome. It was a reality which we were looking at, and that was, to a large extent, a certain amount of creeping trust deficit between caregivers and their patients. With the coming of the COVID crisis, a war-like situation, the initial response of society was amazing. To them, what was given in yesteryears, that the doctor was like a god, that feeling of a person who is helpless can appeal to somebody to pull them out of their unfortunate circumstances, that person was the doctor. And the acknowledgement globally was of huge appreciation, whether all across the world they were clapping for doctors and caregivers. And somewhere along the line, there was an element of discomfiture, if I may put it that way, that when you lost a loved one, the first person that you hit out on was a doctor. Now, there can be various reasons for it, all explainable, or to a large extent which can be addressed. But what has come to being today is that this pandemic has shown that it is like a war-like situation. Does it warrant, does it merit that doctors are treated with the same respect that our armed forces are treated with? Do they merit that kind of continuity in trust? Are there some gaps that doctors perhaps have to pitch into, caregivers have to pitch into? Is there an understanding with this burst of social media and the media at large to be more responsible as far as bridging this gap? So without much ado, I would like to first turn to Dr. Mohsin Wali, an extremely distinguished physician. He has been the physician to many presidents and himself a COVID survivor after going through a traumatic experience. So, Dr. Wali, would I be right in saying that the trust deficit that was there earlier, has it widened or has it shortened in your opinion? Over to you, Dr. Wali.
Thank you, ma'am. And first of all, I would thank Voice of Healthcare and its team, Dr. Naveen Nishchal, and especially to you, ma'am, to enlighten us on your vast experience, because you have a peculiar experience which very few doctors in the world would have, as a pathologist initially and then as a corporate, and you had so many organizations still now. So it is worth to share your thoughts with you and to learn more of a learning from you. And let me seek your permission to share the screen, and then I would wish the audience also a happy Doctor's Day. And we have to be like this man who we call like Dr. B.C. Roy. If you permit me sharing, can you see my screen?
Yes, your screen is visible. Please go ahead, Doctor.
Oh, So this Dr. B.C. Roy was also like some overlapping qualities like you and most of us, that he was a politician and he was a doctor, and he taught us so many things. And what we basically taught was what we are going to talk today. He was a clinician at par, and he taught us clinical medicine, and that's how we remember him. And in his name and his memory and his birthday, and incidentally he died on the same day, we are celebrating Happy Doctors Day. But some people otherwise also wants to.
लेकिन हमारे बीच कुछ ऐसे लोग हैं जो बिना पूछे, बिना जताए हमारी सेवा में दिन रात लगे रहते हैं। मैनकाइंड फार्मा हमारे देश के तमाम डॉक्टर्स की इस सेल्फलेस स्पिरिट को सैल्यूट करता है। Happy Doctors Day.
And it's a fortune for ourselves. And we lost some of the very dear and senior colleagues in the COVID pandemics. We must give a tribute to them. Doctor from LNJP. So coming to what we're talking is, there is a gross overlap between the doctor world and patient world, and we cross it at T point, as we say in the vernacular language, go and turn from the T point. So this T point is very important in the doctor-patient relationship, and we should maintain that. I must say, this was my teacher's group photograph, and what is very, very prominent in this photograph is they were very simple people. Although they were mostly FRCS, MRCPs at that time, but they were simple, and so were the students. They were also very simple. Most of the students here are not wearing tie and jacket, and I was one of them at that time. So what is taught through the legends and Bhagavad Gita is what we have to practice. And that's why I am starting my answer with this Bhagavad Gita slok.
कर्मण्यवाधिकारस्ते मा फलेषु कदाचन मा कर्म फल हेतुर्भु मा ते संगोस्त्व कर्मणि.
I will be very short, but I can't stop myself without showing this definition of failure and success, that confidence and the hard work is the best medicine to kill the disease called failure. And if we have confidence, we will bring success and we will be on the right path. So I have made a small mnemonic as per my 45 years of experience, what a doctor should be. He should be a dedicated performer, outstanding angel for the people, courteous human being, technically sound and on demand, always available. And they also want him to be righteous soul. Then what I say to my students always, treat your patients like your baby. And these are the 11 things which I have summarized. I'll finish them within a minute. 11 most important things which the patients want from their doctors. First and foremost is transparency. And this transparency is very important because transparency is what the first thing patient would like. And then we have active listening, effective communication, trust, empathy, and respect, and care and connection, access, and clear instructions. Most of the patients complained that we did not understand what the doctor told us. And this is also important. And when I say this, I say patients should receive fullest attention. And these are the 8 things which we also expect, that we should have continuity with our physician from the patient side. Respect, patient is free to ask questions, and he should take regular medicines. Most of the patients don't take diuretics and they come back in the cardiac failure to my practice. Take notes and bring them, record them and show it to the doctor. And as we were talking, this telemedicine and internet can be a useful tool on both the sides. If they read too much, bad. If they read less, good. And they should give a feedback to the doctors and plan ahead. This is what is most important. serve the patients till you drop. But this is one more thing which is creeping in the young generation, that doctors are not getting fulfillment of the life. Suicides are very common. And this is one of the things which I keep telling to my young students, that you don't get carried away into thinking of their superior status. We should be humble. Once this superiority creeps in, it develops into ego, which is cancerous, and it will keep going until it kills us. I would suggest the young doctors to stay humble and listen to their patients with patience. So in this area of infodemic, many new things are creeping in, and we are also part of it. So we should practice Hippocratic oath. Always remember, read it at least once in a year. And best things which I have sorted out in the ancient Hippocratic oath is not to do harm and injustice, and guard your life and technique for the patient. There are people like Dr. Devi Shetty who have great initiatives, and they are very successful in bringing cheap and less costly medical care, as my colleague was just before the talk was talking. So we have to subsidize it by the numbers. And this is one of the hospitals he motivated L&T to make for the cardiac patients, and he would have a series of these hospitals. The other thing is very important to keep the relationship. We should try to call our patient often on, which they very much like, educate the patient. And especially in the COVID era, we are seeing a lot of patients. Just now a girl sent me a message, 9 months she is not fully recovered. And then I have made a mnemonic of facts for COVID and show concern. These facts is, again, I keep repeating to my every patient every day: cover the face, avoid crowd, clean hands, keep 2-meter distance or more for the Delta variant, and self-isolate and book a test if you have symptoms, and vaccinate. And this Delta variant is feared much by WHO recently, so we have this weapon and shield, that is vaccination. And in the last, I would say we should all be proud to be a doctor. It's a profession with a special mission, a devotion, and one of the finest. We are one of the finest creation of the God. It calls for involvement, respect, and willingness to help others, irrespective of their circumstances. So this is very important, and this is what I have felt during my career. And one thing which brings us together is connect, which Dr. Shabnam Singh wants to emphasize in this program. And this connect is very important. And one of the methods, by one of the professors told me, that take the blood pressure of the patient always. Those days we had sphygmomanometers of mercury type. And today in my clinic, when my boys take the blood pressure, they get so connected to the patient that on my phone, the patients ask, where is your boy of this name? So I feel very proud that the patient has developed a connect between my staff, only because of one thing which my professors told, that take the blood pressure of every patient. And this way we diagnose at least 1 or 2 new cases of the blood pressure. So summing up, it's a noble profession today as well. It will remain noble profession throughout, and we should be righteous people to practice this profession and improve our performance day by day. And there is one thing more which I do, and I would suggest everybody to do, is introspection. At the end of the day, I ask my staff, all the patients have got satisfied. I often ask them if they have no satisfaction. I try to answer their queries. So introspection in this profession is very important, which is very difficult to practice also. So we have to be very united. This is what we lack. And I would say we should try to emulate Dr. B.C. Roy to some extent, because we can't be Dr. B.C. Roy. So today especially, it is the day belongs to Dr. B.C. Roy. And our message to all our junior doctors is that try to read about him, try to read about Hippocrates' oath, and try to learn from your teachers. They are always good teachers. There are always good teachers, and we should learn bedside medicine more than the textbook or computer medicine, because that makes us a perfect doctor and a good doctor. And I would always say there are no bad doctors, because when a lawyer fights in the court, one lawyer loses and one wins. It is in every case all around the world, but they are never called bad lawyer and good lawyer. So similarly, we win in 90 to 95% situations. So people have no right to call anyone as a bad doctor. So every doctor is a good doctor, and we should seek help from the God always, and that makes us conscientious, and also noble in our intentions. And I have seen the results of practicing some of these points, that people get such a good connect and they have praises. And we do not become good by performing good, but we become good by listening good from the mouth of patients, and that is what they feel about our services. Ma'am, thank you very much.
Thank you. Thank you so much, Dr. Wali, for setting the context. And I'll just take one or two points from you and then move to Dr. Malik. Dr. Malik is the CEO of Omni Group of Hospitals, which is a corporate hospital. So 2 points that Dr. Wali highlighted, Dr. Malik, was that the I in me, the sense is that the I in me for the younger generation is there. Secondly, that as far as the profession is concerned, the commercialization of the profession, right? And that is why he alluded to Narayana Hirdale and saying that we should have facilities which are not only accessible, but should not impact the pocket of people to such an extent that its nuances take a different color. You are a keen interest in behavioral sciences, right? Changing behavior is part of what we exist today. So for instance, in earlier days, when in the advertising, the jargon was your advertisement should be 16 seconds to be able to capture a person's imagination. Today, it came, the beginning of COVID, it was 9 seconds. And I think by the end of COVID, it will be literally 3 seconds. So how do you view it from that lens of behavioral science as to this changing dynamic impacting this relationship? Over to you, Dr. Malik.
Thank you, Dr. Shabnam. See, there are many factors at play here. And it's not only that corporate hospitals have become very money-minded. We as a society have become very rude. I mean, you imagine those of us who have traveled overseas and who have lived and worked overseas, they will watch for it. In no other country you will find a patron shouting at a waiter just because a dish got delayed. We see that every day in India, right? So we as a society, especially in the cities, have become a rude society. And the same rudeness comes up when the patients talk to the doctors. Of course, patients, as I strongly believe, for the patient, the relationship has become, the doctor-patient relationship has become a relationship of commerce instead of a relationship of trust, as it used to be in the days of our professors, where a doctor can do no harm and he will always touch the feet. Even if his son or his father has died, he will think that, oh, the doctor tried his best. It was not in our destiny that my relative would survive, right? We've seen so many of them. But today that doesn't happen. He will break the hospital, he will refuse to pay the bill and stuff like that, right? Now, Professor Wali brought out a very beautiful point that we're not connecting with our patients, right? We need to learn to connect with our patients. And it's the same thing. What is different between an Apple store and any other store? Anybody who has shopped in an Apple store will know how they connect with anybody who walks in, right? One of the top 4 consulting companies in India did a study for a very big brand. It's a private study. One of the partners told me, so I can't reveal the name. They did it across 3,000 patients and 6 locations. They asked the patient, how has been your experience while he was in the hospital, at the time of discharge, and 4 weeks post-discharge. It's a very interesting study. And so the patient's response in the first 2 events, that is at the time in the hospital and at the time of discharge, was, the results were always late and my discharge got delayed and admission process took so much time and the tea was cold and the food was not good, and all operational issues. But guess what? 3 to 4 weeks after discharge, the only thing he remembered was, the nurse was very kind and the doctor never had time for me. Or the doctor was very nice and the nurse was very rude. The patient only remembers the quality of human touch points. Only remembers that, whether it is India or it is New York. One of my best friends, I've been in the IT industry for 5 years, so probably one of the very few senior doctors who did IT full time. At that time, there's this friend of mine who was in Chicago. Hey, this is a rich guy worth 100 million. He could go to any hospital. He had a lot of cardiac events. And so I asked him, so why did you go to this particular hospital? Great doctors? He said, no. That the nurse in ER, the moment she used to see me, oh, you poor boy, you have come back again. Don't worry, we'll look after you. With such a big, warm smile, I used to feel welcomed. I used to feel safe. I said, the second hospital you go to, there must be better doctors there. He said, no, hello. Every hospital has good doctors. There, the guy who used to wheel me into the cath lab, the porter, old man, he used to talk so wisely and so nicely, and I used to feel so nice while I'm being wheeled into the cath lab. See, it's the way we talk to our patients. Are we talking to them with compassion, or are we talking to them with rudeness? Are we ignoring them, or are we making them feel welcome? That is so important. And unfortunately, this is not part of the medical curriculum. So young doctors, they come out thinking that they'll make a lot of money, which they will if they are good doctors. But nobody teaches them that you need to connect. I don't know why it is not how to connect to patients at a human level, how to connect to patients, with compassion. It's so important. I mean, it is, we have all seen Munna Bhai, but we don't remember, many people don't know that Munna Bhai is based on a Hollywood movie called Patch Adams. And Patch Adams is based on the life of a real doctor. Okay? And if you permit, I would like to share a scene in that movie. Okay? And it tells how a doctor should behave. And so this guy has been, taken to a court of practicing medicine when he's not supposed to practice. And it is...
So why? Okay, it's coming.
Medicine without a license. It's a very grave charge, son. Are you aware that it's unlawful to practice medicine without a medical license?
Yes, sir, I am.
Are you aware that running a medical clinic without the proper licensing can place both you and the public in a great deal of danger?
Is a home a clinic, sir?
If you are admitting patients and treating them, physical location is irrelevant.
Yes, sir. Will you define treatment for me?
Yes, treatment would be defined as the care of a patient seeking medical attention. Have you been treating patients, Mr. Adams?
Well, sir, I live with several people. They come and go as they please. I offer them whatever help I can.
Mr. Adams, have you or have you not been treating patients at your ranch?
Everyone who comes to the ranch is a patient, yes. And every person who comes to the ranch is also a doctor.
I'm sorry.
Every person who comes to the ranch is in need of some form of physical or mental help. They're patients. But also every person who comes to the ranch is in charge of taking care of someone else. Whether it's cooking for them, cleaning them, or even a simple task as listening. That makes them doctors. I use that term broadly, gentlemen, but is not a doctor someone who helps someone else? When did the term doctor get treated with such reverence as, oh, right this way, Dr. Smith, or, excuse me, Dr. Scholes, what wonderful foot pads, or, pardon me, Dr. Patterson, but your flatulence has no odor. At what point in history did a doctor become more than a trusted and learned friend who visited and treated the ill? Now, you ask me if I've been practicing medicine. Well, if this means opening your door to those in need, those in pain, caring for them, listening to them, applying a cold cloth until a fever breaks, if this is practicing medicine, if this is treating a patient, then I am guilty as charged, sir.
Did you consider the ramifications of your actions? What?
So, that's brilliant.
That's an amazing movie. I recommend everybody to see it. I take classes on soft skills for undergraduates, and I tell all of them to see this movie, right? So we need to teach our doctors how to relate with the patients, how to treat them with compassion, how to spend time with them, how to touch them. Why is it so important to touch them? Why taking their pulse or taking their blood pressure is so important? Even if your nurse has taken it, you take it yourself, because that touch connects you to the patient.
That's a brilliant thought, and I'd request you to hold that while we circle back. Sure. It gives me the opening, Dr. Satyanarayan, for you. The institution in which you work, Manipal, it's one of the iconic institutions which has been in education, if I'm not wrong, from the 1950s, right? And many young doctors are coming out from your institution all across the world. What is it exactly, like what Dr. Bali and Dr. Malik have highlighted, that this personal, intimate connect with patients obviously is being done very well at Manipal, right? And do you see this impacting, or was one of the core reasons prior to COVID? And given the challenges that all of us have faced, that when you were smothered in PPE, people were walking with their names plastered to their backs so that the patient could identify the caregiver. What would your thoughts be? Over to you, Dr. Satyanarayan.
Thank you, madam. Good morning. Greetings to all the distinguished co-panelists. Greetings to all the healthcare professionals, doctors, nurses on this Doctor's Day. Trust is a must, and there has to be sufficient efforts, mainly by the medical fraternity to. So for about 9 years, I worked in a missionary hospital, then moved over to abroad. And after 12 years working in hospitals in Australia, being affiliated with John Hopkins, somebody asked me, what did you learn abroad? All I felt was, all that I learned in India. But one novel thing I learned abroad was to treat a patient as an individual. In my case note, I would never write that so-and-so is a case of cirrhosis. So-and-so is a case of. Every individual needs to be considered as a wholesome individual with certain medical ailments, which we are here to address. Patient connect is of paramount importance. recognizing them by name, meet and greet, all this, plus asking them what is their, the most important problem from their perspective, rather than looking into what are the points of meeting a medical criteria. These are of paramount importance. However, in the pandemic, there is a new normal. The patient wears a mask, the doctor is in PPE, nurses are in PPE. In the peak of pandemic, there is time constraint. The amount of time you spend is going to be drastically reduced. There is the masking effect. There is also distancing, and patients will go through denial. They will feel that the test report could be wrong. So every aspect needs tactful redirection, putting simple, plain evidence, facts, also what we call as understanding from a patient's perspective, or the EQ rather than the IQ of the doctor. The EQ matters a lot. We need to know where the patient is heading to, what is he thinking, he or she is thinking, and our responses are to be addressed from that particular angle. There is also going to be anxiety, anger, because of the pandemic, because of the economic, because of the restrictions, the social isolation that everybody may feel. There will be depression, guilt issues of having picked up an infection or having infected others. There will also be bargaining. Somebody may say, I don't want a scan, I want an X-ray, I don't want this. So there are also, as Professor Wali mentioned, the info media pandemic. Therefore, the social media plays a very, very important role in either misdirecting or directing the patients to either ask rightful questions or may come in the way of delivering essential treatment. We also need to look at recognizing death when we see that somebody is actually not doing well. And it takes a lot of courage, a conviction to walk up to the family and say that this person is not doing well and these are the reasons, and what we should offer is comfort care. There are number of other issues. There will be issues in offering the rightful treatment, but delay in offering treatment because somebody needs a surgery. You feel it is not an essential surgery. Surgical guidelines indicate 6 weeks, wait and watch post-COVID. So it takes a lot of communication. One of the things that I have seen between India and abroad is we have a good opportunity here because we don't have too draconian EMR as we see in the West. The doctors do not maintain an eye contact because of the electronic medical records abroad. They are handicapped in that way. Whether it is corporate hospital or a state hospital, Medicare facilitated hospital abroad, there will be lots and lots of trust deficit issues. However, I think on this day, we should all resolve, inspire our youngsters, younger doctors to look at the nobility of the profession that was established by giants like Professor Wali and others. Then try to inculcate those qualities in the youngsters by we setting an example, because I have seen more than 4,000 patients in the first wave. I don't know how many thousands I have seen in the second wave, and the outcome experience is a mixed bag. Maybe 90% of that has translated into patients bringing anything from a bouquet to ghee to rice to vegetables like the good old times. And maybe 10% where I have received a comment or a feedback. But the most important thing is take the feedback in the right spirit. And as what our co-panelist said, introspect. There are times when I have not slept because I felt I didn't do anything wrong. Rather, I went out of the way. Why did I deserve this comment? Now, if we do not introspect, then the scope for improvement is a full stop. We will never tend to improve. So, introspection is good, and always have a kind of commitment that comes first. My wife once asked me, in the pandemic, you have not taken a single day off, 1.5 years. There will be burnout syndrome, so why don't you take? I just thought for a minute, if it is my own immediate family member who has got COVID, would I be staying at home? Therefore, this pandemic should serve as an opportunity for each and every healthcare professional, including doctors, to give something back to the society. And that is the way I look. Thank you, madam, for this opportunity.
Thank you so much, Doc, for your words of wisdom, as well as I can feel and hear the passion with which you are communicating, having worked all over the world. Dr. Geetika, I'll turn to you now. So Dr. Geetika Patel is the Medical Director of Parul Sevashram Medical College. Given what has been said till now, Geetika, and the fact that you are an academic institution, right? The changing scenario and the challenges which the kind of patients would come to you in your facility, what would your take-home messages be based on the experiences that you have for this very important piece? Over to you, Geetika.
Thank you, Dr. Shabnam. So first of all, I'd like to wish all the doctors here a very happy Doctors' Day. Very nice words have been told by the senior colleagues. So I am not a practicing doctor. I am a public health expert, but managing and into the administration of a medical college and hospitals and other medical institutions. I have seen a lot of change happening, as discussed by the esteemed panelist earlier, a change happening across this period of 10 years. So as Dr. Malik was mentioning about the rudeness in the society which has come. So to some point, I agree with him saying that I feel there is a lot of lack of patience which is happening in the generation today. We feel the doctors, they get very impatient on small things very soon, and the answerability with a lot of patients is something which is lacking today. As we were talking about the young doctors who are studying in our colleges these days, who are the budding doctors who are going to become doctors tomorrow. So it has become really of utmost concern to teach these students, to teach these budding doctors with the proper communication, the connect with the patients, which is of utmost concern. So bringing into knowledge something about ATCOM, which has, so this has been realized by the council, by the colleges and all the education institutions. And a module known as ATCOM, which means attitude, ethics and communication, has been brought into picture for the medical students. And I'm really glad to share that this is a wonderfully built up module, which actually teaches the students what is a good doctor, what is a bad doctor. As we discussed, there are no bad doctors, but what is a good approach, what is the best approach, what is not a good approach is being taught in this module. So I'm really very hopeful that with this module, with such kind of learning which is incorporated into the education system, there will be some positive changes which will happen in the approach of the budding doctors, which we are making as education institutions. If we talk about the COVID pandemic, much has already been talked, so I'll not overlap the things. But I feel, yeah, the new normal has established. There is a lot of disconnect which has come between the patients and the doctors because of the physical disconnect which has come. The doctors are really very scared to spend more time with the patients. The person sitting next to you might be having COVID, so you're always in a hurry to just quickly write the prescription and make sure the patient goes away out of your cabin. So that has been happening across in the last 1 year. and this physical separation has somehow led to more distrust, which I feel in the time of COVID pandemic. So the patients are not being examined well by the physicians. They are not counseled. Most of the time, the families were being counseled telephonically, and the patients, the enough amount of time which was supposed to be spent with the patients was not happening. So the COVID pandemic, though, as I was telling earlier, that it has led to realization of the importance of the medical profession, but the distrust between the patient and the doctors has increased to a certain extent, which we need to overcome. So what I feel the keys are, as very rightly stressed out, was the correct connect. I feel the doctor-patient relationship is one of the very rare relationships. I can call it as a sacrosanct relationships, which shall not change over the period of time. And the correct connect, empathy, it is driven by, I will say, 5 E's, which are empathy, efficiency, empowerment, ease, and environment. The ease and environment is on the institutions to establish where the patients are comfortably taking with ease, they are taking the treatment. And the last thing which I feel is very crucial and important is making the patients and the families informed at every stage of the treatment. What usually we have seen happening is at the last stage, the patients are informed that the patient is worsening. It's a utmost responsibility of every practitioner and the associated team to keep the patient informed about what is being done to him at every single stage. For example, if a patient has come to us on day 1 and is getting discharged on day 30, so we need to inform and update on every single day what is happening. If there is an improvement, that also needs to be informed. If there is a worsening, that also needs to be informed. And one more important point is that now we are seeing that in the tertiary care hospitals like us, the doctors are overworked sometimes. So there are, a doctor cannot spend 30 minutes or 20 minutes with the patient. So the primary healthcare centers which are referring to patients, certain times there are inappropriate referrals from the smaller centers. The patients are not managed well for initial 2-3 days of the period, which leads to a certain dissatisfaction, discontent, and distrust already. And when this patient turns up to a tertiary care hospital, we have already lost a lot of time. We have already lost a lot of trust on the patient's part, and then it's very difficult on the part of the tertiary care hospital doctors to easily manage the patient. So the inappropriate referrals, the misguiding things which happen at the smaller centers, the small peripheral centers, is the reason for some certain kind of distrust in the tertiary care hospitals, where the doctors, they try to do their best, but certain times there have been a lot of mismanaged at the earlier scale, which leads to a lot of distrust amongst the patients. So these are certain views which I had in this concern. Thank you for giving the opportunity.
Thank you, Geetika. So I'll take the liberty of moderate as a moderator and share 2 experiences many years ago, about 22 years ago, when we were setting up a system of hospitals, and we tried very hard to keep 15-minute gap between patients, right? And the EHR, Dr. Satyanarayan. And the doctors went all up in arms and said that you can't have 15 minutes. I have so many patients. You have to bring it down. Because the second, and we had put a clock there that you could not access the next patient's papers till you didn't spend 15 minutes. Long story short, we had to remove that filter so that they could bring in patients as they went. So this kind of behavioral change brings to light, should it be enforced? Should it be done, let it be as it is, given the fact that we are few doctors, we have to take care of everybody. So what do you do? Then when Geetika mentioned about the constant communication, so in the intensive care unit, Geetika, we tried to put a video camera outside so that the relatives outside could see who, you're not allowed inside the ICU, but at least you could see, the general thing is the patient is in there. I don't know what's happening. I don't even know whether they're dead or alive. So given all these points, and in the interest of time, I'd like to circle back one by one with the entire panel. Today, in the day and era of social media, television screens, regulators are looking at privacy issues, trust issues, right? Is there a take-home message for all us doctors, given the constraints that everybody has spoken, COVID aside? With COVID also, you're totally in garb, and yet the patient needs this touch, feel. Is there any need for us to look at, while regulators are putting pieces together, on the issue of privacy and trust, and also the fact that, yes, there must be freedom of information. Everybody should know everything. So you have the Dr. Googles, the University of Google, University of WhatsApp out there. Is there any merit for us as a combined force of doctors to look at having some filters to ensure that the issues around transparency must be there, communication must be there, yet you have to have empathy, yet to have this touch and feel? Dr. Wali, would you like to take that first? Is there any merit in what I
I have just 2 or 3, 4 slides. I would summarize that. First of all, I would thank you for this sharing your experience. That was great. And this if one smile of a doctor can do miracles. So this is what we are in today. Is my screen visible?
Yes, it's coming up. Yes, it's there.
Yeah, we are in this situation. We can't see things clearly, nor we can see the virus, nor we can see the patient's emotions. And media is trying to throw us a lot of knowledge, a lot of light, a lot of things. So to bridge this distance, a very important thing which I have found myself is a little smile, a little connect. Patient wants to be acknowledged. You see, that if feeling that goes to the patient goes through our availability. If we are not able to talk to the patient, he can call us in the evening, and if we are available, this is what my professor who came back from Canada, Dr. Santosh Kumar, while I was doing MD, taught me that, doctor, those times we didn't have mobile phone. Doctor, your success will be dependent on your availability. So this is what, and we had talked about transparency, what you were talking about, putting camera in the ICU, that's what patient wants. And this is another problem in our country. We have many pathies. So we doctors are asked which pathy is safe. First of all, we should not negate any pathy in our country because we have so many systems. So we should jointly operate, and this is one example. You understand why I brought this, not any product. So we future of the medicine tomorrow is empathy, cooperation. This slide is handing over mark to the police, connect with the forces, admiring them for the service. Once I was sitting in my on my duty when I took former Prime Minister to the Mayo Clinic, I came across a magazine which was for internal circulation among the professors and doctors of the Mayo Clinic. And in one boxed item, I still remember these points were mentioned. Listen carefully, examine peacefully, show your knowledge. Yes, you are a Mayo Clinic doctor, prescribe minimum. And same way, it will take time for me to read that the whole patient moves to us. We can't divide the patient into pieces, and that is what is the tragedy of super specialization, that tomorrow we will become right-hand doctor and left-hand doctors. The one thing, media thing which you were talking is what media shows. Like in this occasion, a couple of days back, this lady was transported among the flooded waters, and then she was, of course, wheeled into the hospital on time, and she was a cardiac patient and life was saved. So we have a lot of innovations in our country, but at the same time, we have a lot of advancements. So we have to keep abreast with the advancements. These days, we are talking about robots. They are being used in medicine. And that's how we are optimizing. This zipline company in Germany has made this. And many, many innovations, like Sir talked about robotics, Dr. Satyanarayana. And they made a Sophie, that is a robot, a human robot, and now they have advanced it to a nurse. And
The
these
Hong
are
Kong team behind
yeah,
celebrity humanoid
and there
robot
is
Sophia is
such
launching a
a
new
robot
prototype,
working in one of the
Grace.
hospitals in India. One of the hospitals in India has this in Tamil Nadu. They have this robot working in the hospital, and this is working in Chennai, Stanley Medical College. So we have to keep updates with the technique, and also do not forget the old methods, the bedside method, the clinical medicine and learning. And Dr. Shabnam Singh would agree with me that the evening hot teaching, what we call as bedside medicine, is now gradually getting out of the medical curriculum in many places, and that is what our doctors are missing today. And while I would like to say goodbye from my talk today, and we salute the doctors to you all and to our team, to our community, for bringing out the best for the people and the best care. So I wish happy Doctor's Day to all. And you know, this is very important. The medicine of tomorrow is holistic medicine. I would quote here in continuity with Dr. Satyanarayana. When I was a child, I used to take medicine for me or for my family, and the doctor would give one bottle of 3 doses sticker and 3 packets puriyas, and would charge 1 rupee. Stakes have gone very high. Stakes have gone very high, and professors used to teach us that you should always prescribe according to the spending capacity of the patient, and that's what we learned. And if we practice that today also, we will be free from any finger pointing. You know, finger pointing comes maximally from those sites where we did not give enough time. This is my observation, or I may be wrong, but most of the time patients are satisfied, then they will praise you, they'll do mouth-to-mouth publicity. And I'm a clinician, I can say that with confidence, that on this Doctor's Day, you are all well versed with what I am talking, and madam is much more experienced than all of us, and governing corporate sector. You taught us ABC of allergy when nobody knew allergy in Delhi and around. So these things are very important. My son recently was discovered to have allergy from ginger, and he would have skin lesions which were shown to the best skin doctors. So this is how small things become big in the life of a patient, and that we can always find out by dedication, devotion, dedicating time. And the media, you know, media does good things also. Like so many channels are doing good programs, positive programs, educating the patients. But they are educating the patients and public more than what we know sometimes. So this is suicidal. This is what we get shocks when the people read too much about medicine, side effects. They Google, as you told, ma'am, you told just now, Dr. Shabnam Singh, you told it very rightly that people should have faith and trust in the doctors, the prescription, and should not read too much of Google, WhatsApp, because we are full of the knowledge. And I once again congratulate all of you, and I beg apologies if I have spoken something incorrect. So
Not to
I'm
worry, Dr. Wali. Thank you.
Thank you very much.
Thank you. So, Dr. Malik, going from what Dr. Wali said, is there any merit? Is there any merit of pushing for any kind of recommendations on regulations or doing a certain amount of information sharing on how you need to communicate? What would your thoughts be?
This is for the educators to figure out, but then definitely those who create curriculums need to include soft skill training as part of the curriculum. It was never part of the curriculum, but I remember our professors, our HODs used to make it a point to drill these things into us, right? Today, I don't think that's happening. And neither at the graduate level nor at the postgraduate level. So you see this unique ability of new doctors of not being able to communicate with their patients, right? I mean, there's this nice little joke I heard that how do you make out whether a cardiologist is British or American trained? You know. So the answer to that was a British trained cardiologist will carry a stethoscope, right? So we are following. We are getting too close to America, unfortunately. You know, we started off with the continental British system of medicine, where there was a lot of respect given to MBBS doctors. There was a lot of respect given to a personal physician. Today, what does an MBBS doctor do? He's not even paid well. He's paid probably in some places as much as a housekeeping supervisor, right? So he doesn't have any respect in his job, zero respect, right? So
That's a
the
very
only thing,
important point. What you're looking at is how do you bring respect back into the profession, and how do you make the base platform, the resident doctor.
See, we need to at a policy level we need to do this. Today the continental system, the British system, works on 70% primary care physicians, 20 to 30% specialists, whereas the American system is the inverted system. 70% are specialists and 20 to 30% are primary care physicians. So and the same thing is coming to India. Today a guy will come with a laceration in the forearm, which can easily be sutured by an MBBS doctor, and probably it will cost him 500 rupees, or it can be sutured by a general surgeon at 5,000 rupees, but he will ask for a plastic surgeon and he'll pay 25,000. That's the escalation of healthcare system, you know. So a guy sitting in primary care is just a referring doctor. He doesn't have any faith in himself. He doesn't have any respect in himself. And it's really sad.
Yeah, so I can see the merit in looking at regulations, and perhaps there was a recent judgment in which it was questioned, why did the MBBS doctor do exactly what you just now said? So perhaps that could be a recommendation. Dr. Satnarayan, over to you, please. What would your inputs be on this?
Yes, I think to basically practice good medicine, please do develop EQ. Every doctor, as my distinguished panelists have said, there is no bad doctors. Everybody is a good doctor. Some are more efficient, some are more up to date, some are more well read. So your IQ does matter, your efficiency does matter, but availability and also sync with the patient, right from the word go, understanding the emotional quotient of a patient is of paramount importance. The days ahead is going to be challenging because of the escalating costs of the healthcare, innovative healthcare coming. But then there is also added to this is the pressure of the social media and information explosion. We have to be skillful and navigate all this, but the center of this hub is in ourselves to deliver the best that we can to the patient in a given circumstance. Thank you.
Thank you. Thank you. Gitika, over to you for the last word.
So, Dr. Sharman, if you're talking about the availability of information and how it is good or it is bad. So, talking about that, I always feel that half-hearted knowledge is worse than ignorance. So these days there is so much of information available on the websites, on the internet, through social media, that the doctors sometimes they get impatient if the patients talk about the information. That I've read something like this. Why are you prescribing me this? So there is a need to understand on the doctor's part that this is a revolution which is happening. See, the availability of information, we are not going to. It's not possible for us to curtail on that. So even if we know so many things about law, we always hire a lawyer if we have to go to the court, right? So whatever is available in the internet, on the website, on the social media is going to be there. But getting impatient on certain things, if a patient mentioned that I read that this symptom could lead to this particular thing, then you are telling me this, the doctors always get impatient. Okay, then you go and ask the Google and you don't come to me. I have seen doctors answering like this. So it's very important for everybody to deal things, absorb what is happening, what changes are coming in the mindset of patients, how the information available to the patients is impacting their wisdom, their approach to talking to doctors, and then analyze that and accordingly deal with the things. Talking about the changes in the curriculum which are required, very correctly mentioned by you, as I earlier mentioned that yes, there are changes definitely which are coming in the curriculum. We have an entire revised curriculum which has come from the National Medical Council now, but it is very correctly told that it's not only the books which teach us, the students will always follow what they learn while practicing. So as the teachers, as the senior doctors are doing towards in the OPDs, the same practice they will learn, they will practice when they become doctors. So it's not only important to bring it to the curriculum and into the books, but it's equally important to change the way we teach and we practice, because whatever we practice is going to be taught automatically. Most of the time the students will observe and learn. It's not that they will study in the books and they learn and then they'll practice. They will always remember what they have seen the senior doctors doing, how they have seen them counsel the patients, how they have seen them, the doctors taking care of the patient as a whole, and the same they will be incorporating in their practice. So it's really important to govern our practices first if we want the students to learn the correct things. And the curriculum, of course, it is important. So the curriculum changes are coming, but it's equally important for the teachers to absorb, to incorporate that curriculum into the practices to make sure the students learn well and practice the correct things.
Thank you, Geetika. So I think we've come to the end of our session. I would be extremely remiss if I were not to thank Voice of Healthcare for having brought us all together on an extremely important day. And I marvel at their ability to pick the right panelists and give me the joy of having to interact with all of you. A very, very warm and heartfelt thanks to all my colleagues, and of course, Khushbu and the team at Voice of Healthcare. Good times are here to come. I've taken some great take-home lessons, as well as thoughts for recommendations, which perhaps voluntarily we can put together, and perhaps even at a global and national level, we can take those recommendations forward. Over to you, Khushbu, and your wonderful team.
Good morning, everyone. My name is Prabdeep Singh, and I am here as your host today for Voice of Healthcare National's Doctors Day Conclave. With me, I have Dr. Sushila Kataria today. She is Senior Director, Internal Medicine at Medanta Medicity Hospital in Gurgaon. She's one of the most esteemed doctors in the country today. And I, your host, Prabdeep Singh, I am CEO at StanPlus, India's largest medical response and ambulance system. Dr. Kataria, it is my honor to have you here with us. And we are going to speak about, how behind the doctor, there is a human. Behind the doctor, there's a family. And behind the doctor, there's emotions and struggles and passions and everything that goes along with being a human being that is in a stressful situation. We all went through an extremely difficult time in COVID wave 2, I believe from March to early June. And it was not easy. It was not easy for us as an ambulance company. And I am certain it was 100 times more difficult for you, whether it is answering phone calls from your own relatives, from your family and friends, or from your patients struggling to figure out if they'll get a bed, if their loved ones are okay, or if they will recover. I believe that COVID has been the primary part of your clinical life for the past year and a half. Dr. Kataria, how did you manage the work-life balance? How did you separate the family and clinical life, especially during wave 2?
Thank you, Prabjit, for having me here. And I'm really, really excited speaking to you. So yes, you're right. The times have not been very easy, but the challenging times have taught us a lot of things. I have been involved in looking after COVID patients since 3rd of March 2020, when the Italians came in, which was an organized group of COVID patients in India for the first time. We were learning for the first time. We had some experience from other countries. We built up our own experience. So how I started, I don't know whether I have been able to have a work-life balance, but how I managed it, that first and foremost, it was important to have a good team. So I prepared a team of, nurses, doctors, and other paramedical staff who can work with us, to motivate them, to tell them this is the time, there is no option of not working. And if you have to work, do it very well. It is very few times that the life will give you an opportunity to play the soldier when you are in the medical field. And this was the time, and this is your time. You can do it happily, you can do it just out of obligation. So better do it happily and you'll do a good job. Only happy people create happiness. On home front, I am a mother of 2 teenagers. I have a husband who has an immune compromised condition. So when I started working in COVID wards, my husband was on high doses of steroids. My kids were appearing for board exams. They were in the middle of their board exams. But I mean, this is something had to be done. There is no excuse. You can find 100 excuses not to do things, but you have to find that one reason to do things. And that one reason is that there is no escape. It has to be done. So I isolated myself. I separated the house in 2 things, my part and their part. And, we ran parallelly. We didn't cross each other. Working on the life balance, whatever little time I had, I would do a little chat on the phone or speak to them and just tell them, whatever you will do, you pass, you fail, you take good marks, I would be proud of you. So they did, both of them did well.
That's amazing. And did you feel at any given point of time that you can't do this anymore? Were you overwhelmed by the complexity, by the difficulty of this all, managing personal and professional? And you were not only managing a professional life, you had the country on your shoulders, right? The doctors, the clinicians, and the clinical staff were literally holding the country on the shoulders. I saw a cartoon, describing the situation in that, where our clinical manpower is supporting all the citizens of the country in breathing easy. And was it too overwhelming at certain times?
During the second wave, yes, there have been few instances where I felt sad. I felt really, really, difficult. But it's not because I can't do it, or maybe, I'm scared for myself. I was never scared for myself or for my family. But there were few incidences which made me saddened, One day, there was for a video call, we called a patient, and the response came that, sorry, the patient has died. Oh. So they gave our condolences and we moved on. My secretary called the next patient and the same response. I was saddened. Something sank in me. I said, let's take a 5-minute break and then we'll move further. So that was the time. And during the second wave, so many people, I was getting almost 1,000 calls every day, maybe 5,000 messages. I didn't have even the heart to go through those messages. So, somebody calls with a lot of expectations. Can you accommodate? And I humbly say that we can't accommodate. Then there was a simple question, where do I go next? There was no answer to that, where do I go next? These were the things when we used to feel sad, but we have to gather ourselves, I was sure of one thing, the humanity will win. COVID is not going to overwhelm us. COVID is not going to win. In the end, we will win. And I would jokingly tell my team, we are just making believe COVID that it is giving a good fight. So we're just giving it little time and we'll overcome it soon.
Dr. Kataria, that's phenomenal, right? Behind every gray cloud, there is sun waiting to show up. So do you have any anecdote or patient experience that one positive experience that brought hope and strength? In this pandemic, I was surprised to hear the words ECMO from people who had no business knowing what ECMO is. I redid so many air ambulances this time, and a lot of patients did recover, right? So I think the country also needs to hear the good stories, the positive news. So any anecdote, Dr. Kataria, that stays with you from either wave 1 or wave 2 of the resilience of the human being, the teamwork, or any anecdote that you have to share that truly humbled you with the positive, and the strength that it brought to your team?
There have been many. There are innumerable, good stories. Every day there was so much happening. I would tell myself there is a book in every day. So there is, during the second wave time, when everybody was struggling with oxygen, one gentleman, he arranged in one night when things were, not going easy, he arranged 100 oxygen cylinders for the hospital, and just he donated it. He did not charge a single penny. And what ill luck would have it, his parents got sick the next day, and they were brought to the hospital, and they stayed with us and recovered, both of them, and went home. But during that time, I said, we have to look after them. We have to look after every patient as like our own. But his son, when he had no interest, no selfish interest to be there, he helped so many people. So those, when they came in, they were like everybody's mama and papa in the hospital. There was another lady who had a CT severity score of 38/40, like 95% of the lungs were involved. And she was not very old also. She was in 40s, and she had children who were going to school and all that. So when she was brought, we thought, whether she would survive or not, let's give our best. And she responded so beautifully. She was discharged. And when she came back to the hospital after 3 weeks visit just to visit me, and I couldn't recognize her, I was so happy that day. And for myself also, so many people, they said, you're not worried. I said, why should I be worried? There's so many prayers with me. My old school teachers called me to say, Beta, we are so proud of you and hope you're fine. My medical college teachers called me, my colleagues called me, my patients just called me to wish good. So I know somebody would just get this haldi milk for me someday. It is so overwhelming. There is so much of goodness around. Even corporate people who had nothing to do with the disease, they were out there to help. They said, tell us if we can arrange something for you. Any PPE kits, gloves, masks. Even a ward boy, one of the security guards in the hospital, this was during the first wave of pandemic, when N95 was a real scarcity. It was more scarcer than gold. I mean, you couldn't just have any N95. We were recycling, doing UV and boiling, steaming, whatever possible to keep it sanitized. So one day I was coming from the ward wearing a simple surgical mask. So this security guard tells me, ma'am, I have one extra N95. I will give it to you. So I said, no, beta, the hospital arranges for me. I have it enough. He said, no, I think you need it more than me. I have one. I will give you that one. I, somehow pacified him that, this time I have enough. If I'll need it, I'll ask for you. But imagine a guy who was just having two and he was ready to share one with me.
It's amazing, Dr. Kataria. These are examples and these are stories that all of us have seen. People going above and beyond their line of duty. People risking their own lives to help others, whether it is Khalsa Aid in Delhi or whether it is Yuva organization here in Hyderabad or it's IYC. There's just so many examples, and it spans all political, all religion, all state boundaries, right? The humanity, the Indianness in all of us really shone through during this wave. While, I don't wish that the wave comes back. I hope that we go back to what we were, merry and jolly 2 years ago. I also believe that we have to be careful, and it's important that we don't let wave 3 come and ravage the country. So during these times, what is a message that you have, for the Indians who are listening, and also to your fellow health practitioners and frontline workers and budding clinicians? Any parting message to all of us, also on how to avoid wave 3, but more importantly on if wave 3 comes, what are the things that we should not let go as principles, as motivations?
So for my fellow Indians, I would say that, precaution saves. Be careful. Don't be fearful. Wear your mask properly if you're going out, and get vaccinated. It is only through good, immune response and vaccination and precautions only we can get rid of this nasty problem. For my fellow doctors and young budding doctors, I would say that, in the heart, keep the patient interest central. Whatever you do not think, when you treat a patient, think what I can do the best, and try to keep on improving yourself. We can never claim to know each and everything which is there in medicine. But to improve upon ourselves every day is our duty. And diseases will come and go. We are here to stay. We are here to stay. We have to support each other. Each doctor has to support each other, be each other's strength, and let us be united in this. Swasth raho, mast raho.
That's amazing. Swasth raho, mast raho. Dr. Kataria, on behalf of VOH, Viatris, Stan Plus, and every Indian, I want to wish an extreme amount of gratitude, and I want to express a very, very deep level of respect for what you and your team at Medanta have done, not only for the people in Delhi, but for people across the country who've flown in to get treatment, who've walked, who've driven. And I believe that if wave 3 were to come, we sleep easy knowing that we have you and your team out there front line as soldiers, as you said, keeping us safe. Thank you so much, Dr. Kataria. Have a wonderful day.
Thank you, Prabhdeep. Thank you so much. Wish you the same. Thank you.
Thank you, Khushbu, and thank you, Voice of Healthcare, for inviting us on the National Doctors' Day. The issue which is to be discussed today is the policy interventions for doctors' safety and their well-being. To begin with, I will say here that safety of doctors, violence against doctors, violence against hospital has been increasing in past 2 to 3 decades. If I recall my childhood, that means early 50s, and even when we get into the school, 60s, 70s, when we passed out from the college, we never used to hear any case related to violence against the doctors. Because if I, share with Dr. Kamlesh Tiwari, the healthcare in 50s and 60s used to be very simple. There will be one doctor, mostly they used to be single doctor clinics. Many of the doctors used to be RMPs, then MBBS, and then they will have a small clinic assisted by one compounder. And the people will go to them. They had total trust in them. In fact, they used to really invite them. Suppose there is a marriage function, the first invitation will go to the family physician. That used to be the kind of respect we had. As the time progressed, 70s came, we started hearing this NCDs, non-communicable diseases, which was not heard. We used to hear only communicable diseases, but this entry of non-communicable diseases came because of we started change in the lifestyle. People started living in a different way. Their diet started becoming different, and we saw the NCDs. And at the same time, the healthcare, which was largely with the government, because government stopped financing the healthcare. Because if you recall, if there was one district hospital at the time of independence, till today there is only one district hospital in the same district. But the population has gone 3 times. So I think that gave entry to the private sector. Early 80s, the private sector started coming. Trust hospital, private hospital, and then the corporate culture, corporate hospital started coming. At the same time, technology started coming. So if you really see, the diagnosis have improved vastly. And we are able to, because of that advancement in the medical technology, we have been able to increase the average life expectancy from 57 years, now it is almost going to 72 years. So I think that is the result of advancement in the healthcare. And at the same time, from MBA, we started getting into the postgraduate qualification, super specialization. So all these things have increased the effectiveness of the healthcare, but at the same time, the cost has also gone up. So one of the opinion is that when we used to respect doctor like anything, and if you ask me, even today the population respect the doctor same way. But when we go to the hospital premises, such a big hospital, and when we see the cost of the healthcare, then many of the people who are below poverty line, they are unable to fund the cost of the healthcare. And so one of the reason I found that violence against hospital and doctors is the increase in the cost of the healthcare. So if you ask me, this is not doctors' fault. People still, I am saying, they respect the doctors in the same way, the way used to respect 50s, 60s, 70s. Only after the corporatization, privatization, medical technology, NCDs, all these things have started, and because population is unable to pay, and so I think that sometimes come as a, you can say, the anger or inability to pay, and they sometimes get into this kind of violence. So I think that is my first question to my expert panelists will be, and Dr. Arun Gupta has also joined here. He is the president of the Delhi Medical Council. मेरा पहला सवाल डॉक्टर कमलेश तिवारी आपसे है कि मुझे पहले ये समझना है कि ये वायलेंस क्यों हो रही है, हम इसको कैसे रोकें, वो बाद में सेकंड राउंड में आएंगे हम लोग। वायलेंस हो क्यों रही है? डॉक्टर का नोबल प्रोफेशन है, इतनी रिस्पेक्ट है उसके लिए, तो डॉक्टर के अगेंस्ट में हम क्यों ऐसी सिक्योरिटी की बातें कर रहे हैं या हॉस्पिटल वाले की मारपीट की बातें? इसके ऊपर आप प्लीज थोड़ा सा प्रकाश डालिए कि व्हाई देयर इज ए वायलेंस अगेंस्ट डॉक्टर्स एंड हॉस्पिटल्स।
सर, जिस जमाने की बात आप कह रहे हैं 30-40 साल पहले की, आप अपने जमाने की, उस समय में पेशेंट का ट्रस्ट डॉक्टर के ऊपर बहुत था, लेकिन डॉक्टर भी पेशेंट को अपने घर का मानता था। वो मानता था कि हमारा फैमिली मेंबर है, और हर फैमिली की राय में डॉक्टर की राय ली जाती थी। आज हम लोग भी पेशेंट से दूर हो गए हैं। ऐसी बात नहीं कि पेशेंट हमसे दूर हो गया है, हम लोग भी पेशेंट से दूर हो गए हैं। अगर हम ही से पूछा जाए कि कितने पेशेंट आपके पास है, आज कौन कौन आए, हम जवाब नहीं दे पाएंगे, क्योंकि नाम कंपाउंडर लिख के रखता है, हम मरीज देख देते हैं। ये हम लोगों में भी कमी आई है। तो इस गैप को भरना संभव तो बिल्कुल नहीं है, लेकिन मिनिमाइज जरूर किया जा सकता है। और इस ट्रस्ट को, ये जो दरार पड़ गई है डॉक्टर और पेशेंट के बीच में, इसको कम जरूर किया जा सकता है, क्योंकि पॉपुलेशन अब बहुत बढ़ गया है। पेशेंट भी तुरंत डॉक्टर बदलते रहते हैं, आज मेरे यहाँ, कल उनके यहाँ, परसों उनके यहाँ। तो ये पैटर्न भी डेवलप कर गया है। तो डॉक्टर और पेशेंट का रिलेशन फैमिली वाला नहीं रह गया है। पहले फैमिली का मतलब कि मरीज मर जाए तो मर जाए, डॉक्टर चेंज नहीं करता था, लेकिन आज सिचुएशन डिफरेंट हो गया है, और इसके जिम्मेदार हम लोग ही हैं। हम लोग क्लिनिक में अपने दोस्तों की शिकायत कभी कभी कर दिया करते हैं, जो पेशेंट सुनता है और वो समझता है कि इनको उनसे नहीं पट रही है, कुछ दिक्कत है। तो एक कारण ये है कि ट्रस्ट हम लोग का टूटते जा रहा है। दूसरा कि वायलेंस का कारण है कि मनी, मरीज परेशान है, आता है हम लोग के पास, हम लोग एक जांच की जरूरत है, 10 जांच लिखते हैं। हम तो जस्टिफाई कर सकते हैं कि ये जांच जरूरी है, लेकिन एक जांच 2 जांच पर भी ट्रीटमेंट हो सकता था। पेशेंट के पास पैसे की कमी है, वो 10 जांच कराने में सक्षम नहीं है, नेचुरल है कि उसका गुस्सा बढ़ेगा। तो उसको कम करने के लिए हम लोग को सिंपैथेटिक होना होगा कि मिनिमम कॉस्ट में जो हमारे पेशेंट का कैलिबर है, औकात है, उस हिसाब से हम उसको जांच लिखें और उस पर इलाज करें। हाँ, अगर हमसे नहीं होता है तो हम उसको रेफर भी कर दें। तो गलतियां सिर्फ पेशेंट के तरफ से नहीं है, कुछ हम लोगों के तरफ से भी है, जिसको पैचअप करना बहुत जरूरी है सर।
ओके, तो डॉक्टर तिवारी, मैं अगर आपकी बात को थोड़ा सा समराइज करूं तो आपने 2 बातें बताई हैं। एक तो आपने बात ये बताई कि पहले लिमिटेड पेशेंट थे, लिमिटेड डॉक्टर्स थे, और लेकिन वो एक पर्सनलाइज रिलेशनशिप बना हुआ था। पॉपुलेशन बढ़ती चली गई है, डॉक्टर्स उस रेशो में नहीं बढ़े हैं, तो ऑब्वियसली आपके लिए ये संभव नहीं है टू कीप ए पर्सनल कॉन्टेक्ट रिलेशनशिप विद योर पेशेंट। हाँ, तो एक तो आपने ये, दूसरा जो आपने कारण बताया कि कॉस्ट बढ़ गई है और कई बार हम लोग एक्स्ट्रा टेस्ट भी लिख देते हैं। तो यहाँ पे मैं थोड़ा सा आपको ये कहना चाहूंगा कि ओवर द पीरियड मेडिकल लीगल केसेस भी बढ़ते चले जा रहे हैं और थोड़ा सा डॉक्टर के अंदर ये डर बैठा ही रहता है कि अगर मैं कहीं ना कहीं मुझे मेडिकल नेग्लिजेंस के लिए भी जिम्मेदार ठहराया जा सकता है। और एक ये हो सकता है कि हमारे यहाँ जो स्किल पढ़ाई जाती थी 50, 60, 70 में, वो स्किल भी थोड़ी सी डाउन हुई है। हम मेडिकल टेक्नोलॉजी पे ज्यादा चले गए हैं। तो जो हम डिफेंसिव मेडिकेशन यूज कर रहे हैं, डिफेंसिव मेडिसिन यूज कर रहे हैं, उसका भी एक वजह है कि हम थोड़े से टेस्ट, यू कैन से दैट, कि हम शायद एक्स्ट्रा लिखते हैं, लेकिन हालांकि ये बात बड़ी डिबेटेबल है। तो ये दोनों इश्यूज के ऊपर कि नंबर ऑफ पेशेंट हमारे बढ़ गए हैं, डॉक्टर की कमी है, पर्सनल रिलेशनशिप खत्म हो गया है और कॉस्ट बढ़ गई है, तो इसके ऊपर मैं डॉक्टर अरुण गुप्ता से चाहूंगा कि आप बताइए हमें कि आपकी सोच के हिसाब से व्हाट आर रियली द रीजन कि मरीज आज थोड़ा सा नाराज है या कभी कभी मारपीट पे भी उतर आता है।
सर इसमें ना मेरा व्यू बहुत क्लियर है। इसको मैं बड़ा होलिस्टिक वे में सोचता हूँ। इसको माइक्रो लेवल पे ना सोच के मैक्रो लेवल पे सोचना पड़ेगा। मुझे ऐसा लगता है कि वो ये टेस्ट लिखा नहीं, वो दवाई लिखी नहीं। आप देखो, मैंने 91 में एमडी पूरी की थी और 90s का एक दौर था जब मैंने प्रैक्टिस स्टार्ट की थी अपनी, और एक 90s का डिकेड था और एक अब लास्ट डिकेड लगा लेते हैं। 30 सालों में मैंने देखा एक बड़ा सी चेंज आया है। अर्ली जब लेट 80s और 90s में जो बेसिक हेल्थ सिस्टम था वो कहीं ना कहीं सरकारी और प्राइवेट में बहुत ज्यादा फर्क नहीं था। जो अवेलेबल था, जो नहीं था। इन 30 सालों में मेडिकल साइंस ने बहुत तरक्की की है। आप देखो पिछले 30 सालों में हमारा जो मेडिकल साइंस है एट पार एज विद एनी इन द वर्ल्ड इन द बेस्ट। अब यूरोप अमेरिका वाली सारी फैसिलिटी अवेलेबल है। हम 30 साल में हमारा मेडिकल साइंस यहाँ से यहाँ पहुंच गया, पर हमारी सोसाइटी कहाँ पहुंच पाई? सोसाइटी की जो ग्रोथ हुई वो एट पार नहीं हुई। सोसाइटी यहाँ से यहाँ पहुंची। तो जो कभी चीज मान लो अवेलेबल नहीं थी, वो इस चीज थी नहीं अवेलेबल, तो अगर आपको इलाज नहीं मिलता था तो आप तसल्ली कर लेते थे कि चलो ठीक है जी, जो था इलाज कराया नहीं, अपना जो भगवान की मर्जी हो गया। अब क्या वो चीज अवेलेबल तो है, पर आप यहाँ पे आपको नजर आ रही है, तो या तो अफोर्डेबल नहीं है, एक्सेसिबल नहीं है। तो दो फैक्टर है। अगर आप मान लो सपोज मैं सरकारी सिस्टम की बात करूं, तो या तो चीज अवेलेबल नहीं है, अवेलेबल है तो एक्सेसिबल नहीं है, अफोर्डेबल हो सकती है। तो आपको बंदे को फ्रस्ट्रेशन होता है कि यार मेरे को एम्स में वो चीज अवेलेबल तो है पर मैं एक्सेसिबल, मेरा कोई पहचान नहीं है, वहाँ भीड़ बहुत ज्यादा है। तो आपको फ्रस्ट्रेशन होगा, तो आप इमरजेंसी में जाओगे, जी मेरे को तो एडमिट कर दो, वो एडमिशन नहीं करेंगे, झगड़ा करोगे उनसे, ठीक है। तो वो नजर आ रही है। दूसरा प्राइवेट में जाएंगे, वहाँ पे अवेलेबल भी है, एक्सेसिबल भी है, पर अफोर्डेबल नहीं है।
अफोर्डेबल नहीं है।
बंदा पहुंचेगा जी, उसकी मतलब अमेरिका में अगर हम 50 लाख की सर्जरी दिल्ली में 5 लाख की कर रहे हैं, पर सोसाइटी 50,000 के लिए तैयार है, तो वो जाएगा बोलेगा जी मैं तो 5 लाख कहाँ से लाऊं? तो फिर वो लड़ेगा, झगड़ेगा, फ्रस्ट्रेटेड होगा, बोलेगा डॉक्टर ने रूट लिया, रिजल्ट नहीं मिला। तो मुझे लगता है कि जो ये डिफरेंशियल ग्रोथ हुई है ना सोसाइटी वर्सेस मेडिकल साइंस की, ये जो गैप आ गया अफोर्डेबिलिटी और एक्सेसिबिलिटी और उसमें अवेलेबिलिटी में, ये कहीं ना कहीं फ्रस्ट्रेशन का कारण। हम जो अपने यहाँ देख रहे हैं, अब लोग ले आते हैं जी 10 लाख वाला इलाज अगर इंडिया में 5 लाख में भी कर रहे हैं, तो बंदा 50,000 के लिए तैयार है। तो हमने बहुत सोसाइटी 30 सालों में, आज इंडिया में कौन सा चीज ऐसी है जो यूरोप में अमेरिका में अवेलेबल, इंडिया में नहीं, सब कुछ है। तो ये मेरे का सबसे बड़ा रीजन है। और दूसरा एक मुझे लगता है कहीं ना कहीं डॉक्टर ज्ञानी में ये भी देखता हूँ कि एक सोसाइटी में जनरलाइज अनरेस्ट भी ज्यादा है आज डेट में। अब इट्स नॉट अबाउट मेडिकल साइंस, वायलेंस एज ए होल, अनरेस्ट, फैमिली में अनरेस्ट बढ़ गया है, सोशल सोसाइटी में बढ़ गया है। कहीं ना कहीं हम लोग ज्यादा पहले से एजिटेटेड रह गए। मे बी इसका मीडिया का कितना रोल है, कितना नहीं है। और तीसरा मुझे लगता है आप मुझसे मुझे पता थोड़ा बहुत असहमत भी हो सकते हैं, जो थोड़ा सा कॉर्पोरेटाइजेशन हुआ है। मैं नहीं कह रहा कि वो लोग कॉर्पोरेट कल्चर आई, अच्छा था कि मेडिकल साइंस को अपने बढ़ाया, पर कहीं ना कहीं इसमें ह्यूमन फेस कम हो गया है। हम लोग जब शुरू में प्रैक्टिस स्टार्ट की तो छोटे चैरिटेबल हॉस्पिटल होते थे, तो उसका जो बॉस एक डॉक्टर होता था कि सर इसके, हम जाते थे कि बॉस ये मरीज है, इसका 20% कम करो, 10% कर दो, तो कर दिया है। अब वो चीज, अब वो डॉक्टर का भी नहीं करते कम। तो वो ने अब हम भी थोड़े से, हमें भी ब्लंटली बोलना पड़ता है, भाई पैसे तो नहीं कमाओगे, एडमिट करना है तो अपना घर जा, क्योंकि हमारे कहने पे वो भी नहीं करेंगे। तो इससे भी एक ना वो कहीं ना कहीं बात बिगड़ से रही है। तो ओके मेडिकल साइंस गैप बहुत बढ़ गया है। नंबर 2, ओवरऑल अनरेस्ट इन सोसाइटी बिकॉज ऑफ जो भी है अर्बनाइजेशन समथिंग। और तीसरा, कॉर्पोरेट कल्चर से थोड़ा ह्यूमन फेस कहीं ना कहीं कम हो रहा है। ये रीजन है मुझे लगता है।
ओके So I think now we welcome Dr. Jayalal. He is not only the president of the IMA, but I look at him as a professor because he goes deep into academics. Because many times I find my clinician friends, they are busy in consultancy, but few of them get into academics. So he is our professor, doctor, I will call him. So Dr. Jayalal, what we were discussing, that in 50s, 60s, 70s, we saw how the healthcare went from simple, technology-oriented, became complicated, complex. And of course, it has helped to increase the life expectancy from 57 years to 73 years. But the cost has gone up. So in first round, I want to ask you, in your opinion, what are the causes of violence against the doctors and the hospital, which was not seen in 50s, 60s, and 70s? Can you elaborate what, in your opinion, are the reasons?
Yeah, thank you very much for this, sir. The first and foremost is the Google and the WhatsApp University, which is giving a wrong sense of information, wrong information to the people, and their expectation are very high. And as the people now started believing as a doctors as an unavoidable evil, and anything which happens beyond their expectation, they always try to think that doctors is the cause. When we are flying in airplane, when the last minute, when we book a ticket, the seat cost is going 25,000, 30,000, but no one blames the pilot. No one goes and attack a pilot. They realize that. But unfortunately, the escalation of the cost, which is happening in the healthcare system, because of the various socio-economic changes, people always think doctor is the cause for that. And when you have a headache, people try to meet a neurologist. When they try to meet a neurologist, he has to do a CT scan, MRI, PET, and so the cost of this is encouraged. So the reason for this, what you had in the 50 and 60, you had a lot of family physicians. And there's a family doctor is there. They go to the family doctor, they know them, probably it is yesterday fight they had in the house, because of that he is having a headache today. So he will be able to just counsel him and give an assurance for him, so he will go back. But today it is not the situation. If the doctor is not taking a MRI, he will be sued in the court. And if he taken an MRI also, he will be sued in the court. And the most important and the next problem which has come is the Consumer Protection Act, which has come in the way, and the lawyers have started coming into the system. Previously, it is only the parents and the patient. Now it always has a triangle. Another either a lawyer or another person is coming in, and they are deciding and stimulating the people. So all these put together, one is the false sense of hope and rumors which are coming through the WhatsApp media, and the system of family medicine system is gone, and system to the top level consultants directly seeing that the consumer protection case, doctors have started a defensive practice which has resulted in the escalation of the price. Fourth, when the people are manpower shortage, which results in the doctors are not willing to spend time in counseling the people. In the Western countries, a general practitioner has to spend 15 minutes, and consultant has to spend 45 minutes with each patient. But what is happening in our hospital? And we are hardly able to spend 1 to 2 minutes in an OP. So all this put together. Finally, I must also say the perception of the society. When my father, I always used to see, he never used to sit in front of my grandfather. But I started sitting in front of my father. But now my son sits in front of me, putting the crossed over leg. So that is the amount of the bonding and social dynamic changes. So that also brought in, there is a disrespect to the elders and disrespect to the professionals. Is a disease which is percolating in the community. So that all this results in this kind of violence in the doctors' communities.
I think you have brought out that point very clearly, and even Arun Gupta also was saying the same thing, that this change, in from physician, general physician or family physician, we have totally forgotten about that, and we straightway go to the not only specialist but the super specialist, for minor ailments. I think that is one of the reason. And secondly, the expectation of the people. I was seeing in the COVID time, I talked to some junior doctors, that I said, why you are prescribing azithromycin, doxycycline, both? They say, sir, if we do not do it, patients say, then what are you prescribing? only vitamin D and all that, they're not happy. So we are writing all this, antibiotics for 10 days. So I think you are right, actually. The society, this Google society, is also putting undue pressure and their expectation is rising. And when their expectations are not realistic, they are not met, they sometimes resort to this violence. So I think this is also an important point other than the cost, which actually has come in. So I think my second round actually now is that we have discussed that these are the fundamental reasons now. But now actually IMA, for example, has been, persuading very forcefully that the violence against the doctor should become non-bailable offense. Partly we have succeeded because recently under the Epidemic Act, this is now a non-bailable warrant. But that is only for under the Pandemic Act. It has not actually been put in the normal course of time, and which again, I think Home Ministry somehow has not been able to do it. So this is, we want to now discuss that besides making it non-bailable warrant, what else should be done at the doctor's level, at the hospital level, to minimize, if not completely eradicate, minimize the violence. So I think we will take few steps from each one of you, what needs to be done. So starting from Professor Kamlesh Tiwari.
Sir, in my opinion, it is change of behaviors of doctors and counseling to the patient in a proper way. That is the best way. Otherwise, any law is not going to help you in any way. Whether you can make a law of even hanging, patient will do it if time will come. So, change in attitude in the patient as well as in doctor, fill the gap between patient and doctor is the solution. Law is not going to help at all. It will help for few months, but later on things will become as usual. So it is change of attitude that will help, and what we should do to change our attitude, or how to change attitude of patient, that is the solution. And I know change can't be done in a day or two. It will take time. But you people should formulate a guideline that these things should, like sympathy to the patient. Nobody has got time to talk to a patient for 5 minutes. No. He will write the treatment for blood pressure and diabetes, but he is not going to explain how to take it. These are the things which causes problem. And compounder is more superior than doctor. He will tell the patient, go, and take the medicine. How patient will know that which medicine should I take at what time? We don't have time. Compounder is super doctor. Who is going to tell them? So these things must change. Otherwise, change will not come, and law is not going to prevent us.
You see, if I want to put it up, this is a chicken and egg story. You see, we are familiar with the API, American Association of Physicians of Indian Origin. They keep talking to us. There are almost 100,000 Indian doctors going there. And Indian doctors today are preferred doctors by the Americans, for the treatment. So that means Indian doctors per se have nothing short in wisdom, in the techniques. Everything is there. But now in America, they go through the junior physician, then they reach to the consultant, and consultant spends average time given to me by RP is around 12 minutes minimum. 12 minutes, average. In India, we worked out the average time is 2.1 minutes. This is the reason is there is no consultants, and family physician concept we have wiped out. So, you really can't blame the doctor because he has 100 patients waiting outside Dr. Jayalal's office for 1 hour. I think this is the crux today. So both things are responsible, our change of system and also the shortage of the specialists. So I think that is also the reason. Otherwise, communication skill, I think there, but of course in recent MBBS curriculum change, we have now brought the subject of communication into the curriculum. Things will improve, but still, I think the main crux is this shortage of the specialists. So let me ask the same point to Dr. Arun Gupta. What do you feel? How can we really minimize these violences?
इसमें सर कुछ पॉइंट्स है मेरे दिमाग में, क्योंकि दिल्ली गवर्नमेंट में जब हमारी बात होती थी तो सजेशन, तो पहले तो सब ह्यूमन साइकोलॉजी को समझना जरूरी है। अब दिल्ली में दो सिस्टम है, एक होता है जनरल रेलवे सिस्टम, एक होता है कि मेट्रो। लोग वही ट्रेवल करने वाले, मेट्रो में कोई थूकता नहीं है, जनरल में सारे थूकते हैं। तो अल्टीमेटली आप ह्यूमन बिहेवियर भी हमेशा कंडीशनिंग होता है सराउंडिंग के, ठीक है। तो आप इसको समझना चाहिए कि जब तक हम हेल्थ केयर वर्कर जो हमारे हैं, मान लो सरकारी सिस्टम है, वहां पे सिस्टम ही इतना खराब है, कैजुअलिटी में एक बेड पे 4 लोग लेटे हुए हैं, वहां गर्मी है, डॉक्टर देखने को नहीं, तो नेचुरली एंगर आता है। तो आपको हेल्थ केयर सिस्टम में इंफ्रास्ट्रक्चर और डॉक्टर से इंप्रूव करना पड़ेगा। ये तो एक बड़ा ब्रॉडर वर्ड है, इसको ठीक कर लो तो कुछ दैट इज इजियर सेड देन दैट, पर 5-6 पॉइंट मेरे छोटे छोटे हैं जो कि वायलेंस वाले को एक्चुअली कम कर सकते हैं ऑन द ग्राउंड। नंबर 1 जो हमने देखा है सरकारी हॉस्पिटल्स में, दिल्ली में खासकर, जो सबसे वल्नरेबल एरिया होता है इमरजेंसी कैजुअलिटी होता है, और वहां अपॉइंट कर देते हो। जूनियर डॉक्टर्स होता है, जेआर होता है, या उसको बेचारे को उतना एक्सपीरियंस नहीं होता टू टैकल हाउ टू टैकल पीपल इन केस ऑफ व्हेन दे आर एंग्री और सम एजिटेटेड, और तो वो और उसको जूनियर को देख करके लोगों को पैसिफाई करना मुश्किल। तो मुझे कैजुअलिटी इमरजेंसी में हमें तो सीनियर डॉक्टर जरूर होना चाहिए, उसका काफी फर्क पड़ता है पैसिफाई करने में। नंबर 2 जो हमारे दिल्ली गवर्नमेंट हम कोशिश कर रहे हैं, हर कैजुअलिटी इमरजेंसी जो वल्नरेबल एरियाज वहां पे सिक्योरिटी गार्ड और कैमरे जरूर होने चाहिए, ताकि हर इवेंट को रिकॉर्ड कर सके, ताकि लोग बच ना सके। तीसरा हमने ये देखा है कि कभी भी वायलेंस होता है तो ज्यादातर कॉम्प्रोमाइज कराने की कोशिश की जाती है, इसलिए कि भाई डॉक्टर सोचता है कौन कोर्ट के चक्कर लगाएगा। तो मुझे लगता है इंस्टीट्यूशनल एफआईआर बहुत जरूरी है, जो दिल्ली में हमने कर दी है कि डॉक्टर एफआईआर नहीं करेगा पर्सनली, इंस्टीट्यूशन एफआईआर करेगा और केस इंस्टीट्यूशन लड़ेगा, ताकि डॉक्टर को कल को हरासमेंट ना हो। ये चीज कर दी है। अगर कोई भी केस ऐसा होता है जहां आपने किसी कल्प्रिट को पकड़ा है या उसको अरेस्ट किया है वायलेंस, उसको वाइडली पब्लिसाइज करना बहुत जरूरी है। चाहे सरकार अपने पैसे से न्यूज छापे, पेपर में न्यूज छापे, ताकि सोसाइटी में मैसेज जाए कि आप ऐसी एक्टिविटी करके बच नहीं सकते। और एक चीज और है, मेरा पॉइंट है यहाँ पे कि जो जैसे उन्होंने अभी आपने बोला सर नॉन अवेलेबल, मुझे तो अभी भी जो लॉ है काफी स्ट्रिक्ट है, स्टिल आई थिंक नॉन अवेलेबल, पर बहुत ज्यादा पुलिस स्टेशन में एसएचओ को पता ही नहीं है। तो हर पुलिस स्टेशन में जाके जो पुलिस और एसएचओ उसको बताया जाए, उनको सेंसिटाइज और उसकी एक बुकलेट रखी जाए, ताकि उनको पता चल जाए कि अगर वायलेंस किया तो कौन सी धारा लगती है, उसको बंदे को कैसे करना है। और एक ये लिखा है कि सोसाइटी में भी जैसे न्यूज़पेपर के थ्रू, जैसे अभी मैंने कुछ दिनों पहले डॉक्टर जीआरएल को पता होगा, हमारा ट्वीट चल रहा था कि अगर एक डॉक्टर के अगेंस्ट वायलेंस होता है तो कम से कम 100 डॉक्टर डिसाइड करते हैं कल तो मेरे को सीरियस पेशेंट नहीं लेना है, किसी न किसी बहाने से, तो अल्टीमेटली लॉस सोसाइटी का है। तो सोसाइटी को इस बात को पहुंचना चाहिए। और आखिरी पॉइंट जो दिल्ली में मैंने देखा, 2 तरह के हॉस्पिटल है, या तो आपके ढाबा है या 5 स्टार है। खराब मिलता है, आप खाना नहीं चाहते हो, 5 स्टार में अफोर्ड नहीं कर सकते, तो हमें सिंगल 2 स्टार 3 स्टार हॉस्पिटल बनाने पड़ेंगे, जो कि फैसिलिटीज हो पर लग्जरी नहीं। हमें टीवी नहीं चाहिए, बड़े फैंसी लॉबीज नहीं चाहिए, हमें बड़े बड़े लग्जरी, सिंपल हॉस्पिटल हो, नीट एंड क्लीन हो, गंदा भी ना हो और वहाँ ट्रीटमेंट हो, तो वो कॉस्ट आपकी काफी कम हो जाएगी। 5 चीज अगर आप करते हो तो मुझे लगता है कहीं ना कहीं वायलेंस काफी कम कर सकते हैं।
I think really you have come out with a very practical points, I must say. Institutional FIR is one of the things, propagation among the police station, and I think evolving the bringing out the low-cost hospitals, with a low frill, what we call. I think this could be a solution.
15,000 सरकारी बेड्स जो ऐड कर रहे हैं, सारे वो बेड्स के बना रहे हैं, सब में एयर कंडीशन होगा, तो मतलब एक बेसिक फैसिलिटी, नीट एंड क्लीन एयर कंडीशन हो तो उससे बड़ा फर्क पड़ता है। लग्जरी टीवी नहीं होगा वहाँ पे, लग्जरी बड़े वो रेस्टोरेंट नहीं होंगे, पर बेसिक केयर सारी देंगे, उसमें उसकी कॉस्ट बहुत कम है, पर उससे बेटर है जो अभी ऑलरेडी चल रहा है, उससे काफी बेटर है।
Good. I think now I come to our president IMA. What actually you really think practically should be done by the policy makers? I think all stakeholders, let me include policy makers, our population, society at large, other stakeholders. How do we really bring them into the common fold to make them understand so that these incidents are gradually minimized?
Yeah, very well said, sir. Now what we need is the manpower should be strengthened in the hospital by producing an optimum fearless atmosphere in the hospital. For that, what law is definitely a useful one. Maybe we cannot completely prevent, but definitely it is useful one. At present, today, we have all the 23 states in our country is having the hospital protection law. But each law has certain lacunas. But if all that is put together into a central law, that will be more easily, it can be implemented, and the percolation to the implementing authority will be also good. Very recently, I had a privilege to meet one of the commissioner of the Delhi, where there is a hospital protection law is for more than 10 years. But they are not aware of such a law is available, because any criminal law needs to have a two component. One is a substantive law and the procedural law. All this law which has been enacted in the state, there is no procedural law is not implemented, incorporated into that. Who has to put the case and who has to do the investigation, how many days it has to be completed. So the cognizant characteristic feature and the procedure code of conduct is not incorporated in the state law. It can be incorporated only it comes in a central law with a tagging of the CRPC or IPC section. That is why we are now insisting on the government should come out with a central law which will have both substantive character and the procedural character will be incorporated, and it must also have the liability of implementing law and order in the hospital. So thereby the government has to come out some protective measures also incorporate inside the hospital. If you see any system of grading an hospital, only the others, all other features, biomedical waste, fire safety, everything is incorporated, but security system of the hospital is never should also include the implementation of declaring hospital as a protected zone, and thereby the hospitals can have a much more broader vision of the safety on that. That is on the one part. Second part, implementation has to be there, and third part, the people should also have a hope or some confidence that they will have some justice if the doctor or the hospital is doing some mistake. So that responsibility lies in the councils of the statutory council. We have a state council and the medical councils are there. If the medical councils and state councils, their action on the hospitals which are doing unethical work or the doctors doing unethical drug can be there for the people to believe that even if they are feeling that it is an injustice is done in their thumb for the hospital, they can fall upon somebody who could have a justice for them. So that confidence needs to be given for the people, and then only the people will have a system that yes, we are feeling aggrieved, but we can go to somebody and we can get the benefit. The third is a stakeholder is the media. Today the media is highlighting, not highlighting somebody is doing 100 successful cardiac transplant, but if there is a one mistake, that has been transmitted very highly. So the positive media building and media awareness has to be created on that. Finally, the most important that our own people, and we are talking with our own people again and again, as rightly said by Dr. Kamlesh, APA chairman, that is a communication. If you are not ready to spend time with your patient in the consultation room, you need to spend more time in the theater, court with a lawyer. So that we are talking to them. Yes, all that difficulties are there. There is a time lag is not there. They are overworked, but not at the expense of either the patient safety or the professional safety. They should adapt to that. And finally, I will also say that what we are communicating, what we need to not to say anything beyond the science. Let us talk about the science and giving a false hope to the people. When the person is coming in a difficult situation, if the doctor is giving a hope, no, come into an ICU, we will settle everything. Or making non-transparent system in an ICU where the person is not communicated what is happening inside the ICU. All this is lead to the speculations and violence. So hospitals should follow a transparent system. Hospitals should have the counselors or the motivators or to explain to the people what is that happening. Then may not be it is a doctor. The person can be there and psychologist can be separately there. Then they will be able to do that, changes will be happening. But if we are not doing something at this moment, the attitude of the doctors are changing, the youngsters are losing the compassion and ethics. I'm sure that is going to be a disastrous situation for this country. As rightly said by Dr. Arun Guptaji, if one doctor is assaulted, another 100 doctors is going to decide that we will not take any emergency cases. But that we need to all the stakeholders, all the senior people we are here, we should interfere in this point very effectively so that the deterioration of the focus of compassion and empathy from the young generation is not being a positive change in the society and positive change in the country when we are going to see that.
Great. I think if the VOH, which is being recording, this seminar, I will ask them to sum up these points together, get it vetted by all of us. I think this should come out a small paper on this one, because I found today the suggestion have been very practical. My one-liner from all of you is going to be the well-being word, because they said safety and well-being. I think well-being has got a very bigger, notation. For example, in my way, I look at a engineer passing from IIT in 4 years, straight away getting into the 70,000 rupees pay packet. MBBS struggles the same way, spent 5.5 years, then spent another 3 years for waiting for PG admission. So, he spent 8.5 and 3, 9.5, 10 years to become a workable doctor. And then we start now treating, leave us out few branded doctors, but otherwise most of them, they fall into this category, अरे doctor को ये लोग ऐसे ही हैं, वैसे ही हैं, वो है. I am afraid that हमारी future generation will we be able to incentivize people to join medicine? और already हमारी shortage और हम ऐसी एक माहौल create कर रहे हैं. तो डॉक्टर का वेलबींग भी एक इशू है भाई, कि हम उसको कैसे करें कि लोग डॉक्टर बनना पसंद करें और उस प्रोफेशन में जाएं. मुझे दो लाइन में अगर ये जवाब दें, तिवारी जी से शुरू होके अरुण गुप्ता, देन डॉक्टर जयलाल. तिवारी जी नहीं है अभी? अच्छा, ही में ज्वाइन. ओके, डॉक्टर अरुण गुप्ता, यू टेल मी, वेलबींग हम डॉक्टर को कैसे, मतलब रियली.
सर मेरे पास ना so many parents come to me as a pediatrician also कि डॉक्टर बनना चाहते हैं, बनाए. बड़ा पैशन होता है, खासकर जो लोग नॉन मेडिको हैं कि अपने बच्चों को डॉक्टर बनाना है. तो मैं हमेशा कहता हूँ, जो आपने मैंने कहा, अगर आपको मनी इज ड्राइविंग फोर्स तो डॉक्टर कभी नहीं बनाना. अगर आपका पैशन है, मतलब हमें पैशन था, हमें था कि मैं अपना देखता कि मैं वार्ड में घूम रहा हूँ स्टेथो पे लटका के और मैं व्हाइट एप्रन में, लोग मुझे कह रहे गुड मॉर्निंग डॉक्टर. मैंने अगर आपकी सपना ड्राइविंग फोर्स है तो आप बनना, अदरवाइज आप सस्टेन नहीं कर पाओगे. बहुत लंबी पढ़ाई होती है और जिंदगी भर का स्ट्रगल है. और ये नंबर 1 पॉइंट हमेशा मेरा ये था कि सपना होना चाहिए डॉक्टर बनने का, पैसे के लिए मत बनो. और सपना बच्चे का होना चाहिए, पेरेंट्स का नहीं होना चाहिए. नंबर 2, आपने सर बहुत सारे एग्जांपल्स देखे हो ऐसे कि 2 भाई थे, एक होशियार था बन गया डॉक्टर, एक था नालायक, वो बैठ गया फैक्ट्री में या दुकान पे. आज की डेट में 10 साल बाद या 15 साल बाद जो नालायक था वो तो मर्सिडीज में और बड़ी बड़ी गाड़ियों में घूम रहा है, हमारा डॉक्टर बेचारा स्कूटर में घूम रहा है. ये बड़ा कॉमन है सर, क्योंकि वो 12th के बाद ही बैठ गया दुकान में, ये बेचारा 10 साल बाद निकला, तब तक वो बिजनेस में कहां से कहां पहुंच गया. तो पैसे में तो आप कभी भी आप बाकी लोगों से कंपेयर नहीं कर सकते. वो ठीक है, बड़े बड़े स्टार्स नजर आते हैं, पर आप नहीं कर सकते. तो पैशन
कैसे जनरेट करें, आप मुझे बताइए, पैशन कैसे जनरेट करें लोगों में?
पैशन तो ऐसा है कि सर, तो पैशन जैसे आपके हमेशा सबके हीरो होते हैं, आइडल हीरोज होते हैं ना. तो हमारे हीरोज होते हैं हर किसी के. तो कोई कहता है मुझे फुटबॉलर बनना है, कोई कहता है जी मुझे पायलट बनना है, किसी को बनना है. तो आज भी अगर आप बच्चों से पूछो तो नंबर 1 प्रोफेसर डॉक्टर ही बोलेगा, कोई भी पूछ करा देख के उसको. पर वो एक छोटी सी क्यूरियोसिटी है, मान सकते हैं उसको. पर मुझे अभी भी लगता है कि पैशन ड्रिवन प्रोफेशन अगर आप बन सकते हो तो अदरवाइज आप फ्रस्ट्रेटेड ही रहोगे हमेशा जिंदगी में. और मुझे कभी किसी मेरे दोस्त ने कहा तो बड़ी अच्छी बात लगी, मैंने सोचा उसको. उसने कहा तू भी वो कभी ऑब्जर्व करना, जो जिस भी कॉलोनी में तुम रहते होगे, आप अपने स्टेटस हिसाब से कॉलोनी बड़ी बड़ी करते जाते हो मकान के हिसाब से, तो उस कॉलोनी का सबसे पुअर होगा वो डॉक्टर होगा. वो जहाँ मैं रहता हूँ ये बड़ी पॉश कॉलोनी, 300 गज के घर है, मेरा एक फ्लोर है और प्रैक्टिकली हर एक के पास मर्सिडीज है, बेंटले है, पर मैं भी होंडा सिटी में घूमता हूँ. तो वो मुझे लगता है बात अपने हिसाब से है, ये बात तो सही है, पर रिस्पेक्ट है मेरी पूरी वहां पे. तो मुझे लगता है कि ये पैशन इज शुड बी द ओनली ड्राइविंग फैक्टर. मनी तो आप कभी मैच कर सकते नहीं, चाहे सीए हो, चाहे वो एक दुकान वाला हो, चाहे लॉयर हो. आप कैन नॉट नेवर मैच दैट.
I think it is the emphasis, onus lies on the IMA. How do we really bring up the, a life-size, image of the doctor? The doctor is good, so that people really aspire to become doctors. And of course, society also looks at them with that esteem. So, few lines from you. What needs to be done?
Yeah, I fully agree with Dr. Arun Gupta ji has said. I normally used to say in a proverb that if you want to be happy, do not get married. And if you want to give the happiness to someone, get married. That holds good for the medical profession also. If you want to be happy, do not be into the profession. If you want to give the happiness to someone, and if your passion is derived by not selfish centered, but it is centered on the empathy and the social oriented, then you are the fit person to come into that. And if you are, but we are not giving the situation like that. To enter into the medical profession, he spent crores of rupees. And it is unfortunate on our part to expect that you need to spend crores and you be this again the sympathetic and compassionate person. So that is a dichotomy we are having. But to be a good doctor, and you must be driven by not a selfish interest, but it's a passionate interest to help others and support others. If you are coming with that interest, even when you are hurt, even when you are injured, you will not be suffered. I always remember a thing: somebody is putting a stone on a tree to get the fruit. Is the intention is only to get the fruits out of the tree and not to hurt the tree. Similarly, if somebody is putting a word or abusing us or even not respecting us, please consider it is not to hurt you, but to bring something more good from you. And that is an opportunity for us to serve more with more dedication, more commitment, more love, and more passion. I think the society will change. If you care for the society, I'm sure the society will care for us. That is a firm belief I always have.
So that's what I was not wrong when I called him, clinician professor. Now I'll call him clinician and not only professor but also philosopher. I think a good tip from you, Kamlesh Tiwari ji. आप मुझे 2 लाइनों में बताइए कि हमें क्या करना चाहिए to improve the image of doctor.
सर, IMA के तो आप बड़े नेता है. मेरी राय है कि डॉक्टरों में क्या कमी है, पहले इसको एक ओपन मीटिंग कराइए बिटवीन डॉक्टर्स, और कोई नहीं रहा है. हमारे में कमी है, ये हम जानते हैं, और हमारी ये कमी हमको बहुत भुगतना पड़ रहा है. ये अपनी कमी से बहुत भुगतना पड़ रहा है. इसको कैसे हम दूर करें, ये हम लोग आपस का मामला है, लेकिन देयर शुड बी सम मीटिंग, क्योंकि कोई मानने के लिए तैयार नहीं है कि हम गलत हैं. नोबडी इज रेडी टू, बट
ये बात है. आपने अरुण गुप्ता जी की बात भी सुनी, जयलाल जी की आपकी बात भी सुनी. ये जो हमने सिस्टम किया है ना, गवर्नमेंट का इन्वेस्टमेंट कम हो गया, कोई डिस्ट्रिक्ट हॉस्पिटल खुलता नहीं है नया, तो सारा प्राइवेट वाले का आगे. प्राइवेट वाले जब पैसा लगाएंगे तो वो फॉर प्रॉफिट होगा, वो कंपल्शन डॉक्टर के ऊपर रिफ्लेक्ट होता है. तो देखिए ये एक बड़ी समस्या है. तो हालांकि आप ठीक कह रहे हैं कि ओनर्स IMA दे कीप ऑन इंट्रोस्पेक्टिंग, कि व्हाट डॉक्टर्स नीड टू डू. एथिक्स के ऊपर काम करते हैं सब लोग. बट आई एग्री, व्हाट आई अंडरस्टैंड व्हाट यू आर ट्राइंग टू पॉइंट आउट, वो हम करेंगे आपस में. बट जो आज का मेरा मुद्दा था हमारा VOH का, सेफ्टी क्यों हो रही है वायलेंस और उसका क्या निदान है, बहुत अच्छे पॉइंट्स आए हैं. आई एम श्योर वी आर गोइंग टू कंपाइल एंड पब्लिश ए स्मॉल पेपर ऑन इट. एंड बाकी जो वेलबींग का इशू है कि जब आदमी 10 साल पढ़ के डॉक्टर बनता है, उसको भी हम कैसे, उसकी भी तो वेलबींग आफ्टर काउंट करती है ना. एक अगर वकील अपनी फीस लेता है 30 लाख, मैं तो हैरान हूँ, हमारे केसेस लड़ते हैं 30 लाख वो एक अपीयरेंस के लेता है. और अगर हमारे अरुण गुप्ता जी उससे 500 रुपए फीस लेते हैं OPD के, तो लोग चिल्लाते हैं, अरे 500 रुपए ले लिए 4 मिनट के. तो आई थिंक समथिंग, सोसाइटी आल्सो हैज टू इवॉल्व. So I think we will work on it. I think this paper, I'm sure, will come out good one, and I will get the paper vetted by all 3 of you. With that, I think I thank my panelists. सबसे eminent panel मैंने आज देखा है. Nothing like it. Thank you very much.
Thank you, sir.
Thank you.
Our honor, sir. Ben honor.
The honor.
Good afternoon, everyone. Welcome to National Doctors Day Conclave, organized by Voice of Healthcare and powered by Viatris. And my name is Prabdeep. I am your host for today. I run StanPlus, India's largest network of ambulances. Today with us, we have Naresh Hasija. Naresh Hasija is Vice President at Viatris, and he joined Viatris, which was then Mylan Pharmaceuticals, in 2015. And has close to 2 decades of experience in the Indian pharmaceutical industry. It wouldn't be wrong to say, Naresh, you've seen the pharmaceutical industry develop, grow into this amazing industry that it is today. And You mentioned that you've always been passionate about affordable innovation and innovative business models throughout your career. We'll speak about that because I think the fight with COVID needed a lot of those business models to come together. At the same time, you truly believe in the potential of public health, and you have your mission to improve the public health in India, and which is also your professional role right now. You at Viatris now manage the public health and also the large corporate hospital business. So Naresh, it's a pleasure to host you here, and thank you for supporting the National Doctors Day Conclave as well. Welcome.
Thank you, Pradeep. Thank you, Voice of Health, for taking up this good initiative on National Doctors Day. Thank you. Look forward to have a good interaction with you.
Naresh, it has not been easy, right? COVID has been difficult for all of us in India, not only in terms of our professional journeys, but also in terms of what we've gone through personally. I hope everyone in your family is okay, being safe. While we all know people that we've, who've been impacted and affected, I think, Naresh, people in healthcare, in pharmaceuticals, in hospitals, in companies, in startups like ours, we've all had a fairly difficult time over the last 4 months managing our personal and professional life. So while I will deep dive into Viatris's role and your role, but I wanted to quickly check in. How has it been for you? How have you been able to manage your work and your life?
So I think when wave 1 started, the most important thing for us was to really make sure we are ready with because we are world's largest, one of the largest antiviral company. So we were introducing remdesivir at that time. So we wanted to make sure this reaches to the masses on time and make sure all our employees are also very, very safe. So our core focus was our factories should function well, our employees should be very safe. So I will give full credit to our R&D as well as manufacturing team for their quick turnaround time around introducing remdesivir for Indian market. I think that was a remarkable job done. It brought, personally, professionally, if you ask me, it brought a lot of discipline to us. And whether it is discipline around our employees who are entering factories, our employees who are doing front ending in hospitals, and if it is our brother, sister, parents, kids at family front. So all of us became very, very disciplined, though it was a very, very tough time during wave 1 and wave 2.
Thanks, Naresh. And Viatris's role in fighting this pandemic cannot be overstated. Not only were you, at scale manufacturer of and distributor of remdesivir, but I think your importance of post-COVID, which is what we learned for the first time. I did not know of an infection known as mucormycosis or black fungus, but the scale up of amphotericin B also had to happen. So tell us some stories about internally at Viatris. What did it mean to A, manage the demand coming in of remdesivir, and B, at the same time, also bring in a massive distribution of amphotericin B, which I'm from pharma, and I remember this drug used to be extremely selective, hardly sold, to suddenly everyone asking for this drug on WhatsApp group. It was very such a strange time for me to notice, because amphotericin B was considered one of the more dangerous antifungals for very severe fungal infections, right? And what happened at Viatris? Tell us some of the inside scoop.
So I will start with remdesivir. Actually, when we introduced remdesivir, and it was very, very emotional moment. We used to get hundreds of calls, relatives, friends, and who were in dire need. And our key focus was public health, actually. So we were the first front runner company who made sure at least all 20-25 states were who were putting their patients on remdesivir get remdesivir on time. I remember, I think then, as all of us say, that for a pharma company, becoming digital is not that easy, because we live like so old stories. Here it was like we introduced, it was necessity is the mother of invention, and we introduced digital supply chain at that time. So our folks were not able to go to ground, not able to reach to the last miles, but we made sure there were digital solutions available, which were reaching to, I will say that, interiors of Maharashtra, interiors of Gujarat. We were able to cater it very well. And on those digital platforms, people were given a lot of education. They were given a lot of, they can place their orders there. So a deep reach was created through this digital channel at the bottom. As well as when, coming to your question about, I think you're talking about liposomal amphotericin B. This was a very, very rare medicine, which is mostly used in transplant cases to avoid fungal infection. So when we saw that, countries figuring it out, and I think then I will say the Department of Pharmaceutical has taken a very quick step, and they intimated us there can be a huge requirement and you guys have to gear up. And this product is not produced by ourselves here in India. We get it from our partner Gilead. So those, I think we as a company, all our seniors, we joined hand together and partnered with Gilead in such a way that both their factories, US as well as Ireland, started I think they diverted all their stock to India at that time. Wow. And I think we could handle crisis very well. Now also I'm sitting here, I think there are a lot of calls coming in, and there is a huge, and again, our focus is we really want to make sure public health premises, all of them should get as much as these medicines available.
This is amazing because you're already, on one hand, you're working with the government at a central level, then you're working with the state and the district administration, you're working with different public health platforms, right? But at the same time, you have your corporate customers, you have large hospitals who are calling and asking. It must have been a tough time balancing the demand and supply marketplace. How did you do it, Naresh? How was the company able to manage the sudden influx of demand, and how did you do the distribution? The fact about the digital intervention is well taken, but how did the distribution happen?
Yeah, so I think there were two things. There was a huge mismatch between production and the demand. So I think I will give credit to a lot of other companies. They came together, and I think when we all started with 4 or 5 plants in India who were producing remdesivir. And when we all, if you see last month, I think what I remember is 11 to 12 plants were producing, 5 to 6 plants of Viatris itself for producing remdesivir. We're working very hard so that we can match this demand.
Excellent. So, and yeah. This is while your plants were scaling up, while COVID was also scaling up. So what this means is that not only did you have to manage the public health, you also had to manage the organization health. That means that you must have had COVID patients both at a senior level and also at people who are working in the plants, people who are part of the security team, right? Almost everyone at that point of time has to also take care of their families. So as a company, Viatris, how did you manage the organizational health?
Yeah, I think the most important thing for us was really taking care of employees' health. I will give full credit to our medical as well as each and every employee who worked during this time. I think I will say that they have really, the way they have shown the discipline to manage COVID is amazing. Does not mean we have not had infections. We have had infections, but our vigilance has helped us so much. Infections were controlled. The people were quarantined. People were quickly taken care, and really, I think it's very heart touching when a product manager who launches remdesivir immediately after launch gets an infection, and this guy keeps working I will say the 16 hours, 18 hours a day during the infection time also. So there were a lot of emotional moments. Similarly, in our factories, where like people who were standing day and night for production of remdesivir, for supply chain of remdesivir, when they get infected, you know that plan A, plan B have to be in place. So I think the plan A people, if they're getting infected, we have plan B, and by the time plan B guy by chance get infected, I think by then plan A guy is back. So overall, this juggling has helped us a lot, and team, we are actually able to come out of this well. We could serve the nation at this moment.
That's phenomenal, Naresh. I think just like a soldier needs the guns and the arms and the defensive, support, doctors and our clinicians and our nurses also require companies like Viatris to continue supporting with medicines. And I think sometimes it's forgotten that the pharmaceutical industry had to step up massively in making sure that the doctors in the interiors, right? Because COVID was not an urban disease. It was spread across. It required balancing of stocks. It required distribution of that stock. And it required also managing counterfeit and making sure that the quality is managed. So I am assuming that at Viatris, these were not easy last 4 months, or it has not been easy for last 1.5 years. How is the company preparing for wave 3?
So for wave 3, I will really admire Department of Pharmaceutical. They have taken a diligent step. You all must have read in the newspaper, yesterday's newspaper also. So what they have done is they have prepared all essential medicines, including remdesivir, liposomal, amphotericin B. They are already in a process of stocking it. So in the beginning of wave 3, if wave 3 comes, and in the beginning of wave 3, we will be very well prepared. I think country will have enough stocks of all the essential medicines. So I think there is a regular dialogue happening between industry and Department of Pharmaceutical, which is helping both the sides very well.
That's very heartening to know. As an industry participant in healthcare, I have to acknowledge the steps that the government has taken at all levels to make sure that we are prepared for wave 3. But it's also a welcoming news to know that we have enough stocks for wave 3 as well. Naresh, as someone whose both parents were hospitalized, both my parents took remdesivir quite early on in the disease. They were fortunate to get it, and they were fortunate to recover and are now safe back home. I, on behalf of everyone who's listening here, give deep gratitude to individuals such as yourself, companies such as Viatris, and the pharmaceutical and the industry at large, pharmaceuticals, biotech. We also have to give credit to companies in the diagnostic space, companies in the medical consumable space. I think the entire country stood up and did whatever possible. I often told my team that we are building the bridge while the river is flooding, right? So it's important for us to acknowledge that the entire healthcare system rose above. And on this National Doctors' Day Conclave, on behalf of doctors and on behalf of the clinical fraternity, I think I take a small portion of that gratitude and I extend it to individuals such as yourself, you and your teams, and companies such as Viatris. Thank you so much.
Thank you, Pradeep. I think the kind of role your company has played is also amazing. I think you would have served thousands of patients every day, night, in really taking care of them at that moment when they need the most. And I thank Voice of Health also for conducting this kind of sessions. Thank you.
Thank you so much, Naresh, and thank you to Voice of Health as well for bringing us together on this platform. Have a great day ahead and keep fighting. I think we are not done with COVID, and your motivation, your undying spirit is extremely important if you have to fight wave 3. Thank you.
Thank you, gentlemen.
Good afternoon, everyone. This is your host, Pradeep Singh, and I am here for National Doctors Day Conclave, which is organized by Voice of Healthcare, powered by Viatris, and hosted by StanPlus. CEO, myself, Pradeep, and I'm here with Dr. Prabjeet Singh. I'm humbled, I'm honored to have him here. He's been fighting with his team COVID for almost over a year and a half now. He's assistant civil surgeon for District Muktsar, Punjab, and Dr. Prabjeet told me that he has, as of yesterday, treated over 18,000 COVID patients or handled 18,600 precise COVID cases. Dr. Prabjeet, thank you for being with us, sir. First of all, I wanted to wish you a very happy National Doctors Day. I don't think that words can do justice to what the doctors and the fraternity have done for the country over the last year and a half. I am sure that while a lot of training covers this, the scale of what has happened, the scale of impact in COVID wave 2 has been unprecedented. Dr. Prabjeet, I wanted to check with you very quickly, sir. Behind the doctor, behind the person answering thousands of calls, there's a human, sir. And while I believe that COVID has been a primary part of your clinical life, how was it personally for you managing all of this? Tell us something about you, sir, your family, and how they were impacted during this time, please.
Okay, it's good to share my personal experiences at this stage, because I think somehow listening to other people's stories helps us too. So I've been working here. It's a small town called Malot. It's in the south of Punjab, and not many people would have heard about it. It's a town about 2 lakh population. It's a small town, and we've got one civil hospital where I work, and I've been working there for the last 15 years. And I'm the sole medical specialist in that hospital. Since our district, Muktsar, hasn't got too many medical experts, we were just 2 people when COVID hit us. So it was left on me and another guy to handle the situation. And we were kind of rushed to the district headquarters, Muktsar Sahib, to handle these people. And it's all started when a couple of Tablighi guys from Delhi, they came to Muktsar. And they tested, 1 or 2 of them tested positive, and we were sent to Muktsar. So we had to travel every day. 12 hours, we did 12 hours each, or 12 hours of duty each person was doing. Since being just 2 people on duty, it made a lot of difficult for us to handle, away from our homes too. Overall, but looking back now, it seems that it was okay, but at that moment of time, it looked very difficult. And so, tell us something about your family. 12-hour duty, right? Is 8 a.m. It was 24 hours duty. One day I was there, one day the other guy was there. We would spend 12 hours at the hospital, and next 12 hours we were on call. If somebody needed us, we had to go back, and it was like 30 kilometers up and down. The roads are not too good in this part of the world. And how did your family take that? For my family, I've got my mother and my daughter. My daughter is doing her medicine. She's an MBBS at Patiala. And my mother, my mother looks after me at home. So that's my family. Wow, sir. So you were managing your personal life, you were managing the patients' lives. So I'm assuming it wasn't easy. So, a lot of gratitude. It wasn't easy to start with. It wasn't easy. And since the COVID hit us, it was a brand new disease, and we didn't know much about the disease like everybody else. So we didn't know what to expect from it. There was a lot of fear psychosis too. Very interesting. So I would love to hear some stories, some anecdotes, right? We'll do both positive and I wouldn't say negative, but where, you were at the edge of breaking down, where you didn't know what's happening. So let me start by asking a slightly more humbling experience. Dr. Prabjeet, do you remember a time where everything was breaking around you? Any story or any anecdote during wave 2? I would I would divide my experience with COVID into two parts. The first part is the first wave, and the second part is the second wave. I have to do that because as the first wave went by, we crossed to the first wave. I got promoted as the assistant civil surgeon of the district. So the first part included managing patients as a medical specialist firsthand, wearing those PPE kits, started from sampling stage onwards to management of the cases, everything included. That was the first part of my job. That was during the first wave. So that was a very tough time, and it was a summertime. We used to wear our PPE kits and all sweaty inside, and we had to kind of first interview the patients, then get them sampled, and the positives were admitted to the ward, and we had to go and manage their treatments and look after them. And while nothing was very clear about the management of these patients, it all got clearer as the things went by. So that was the first part of my experience with COVID. Was the first wave, and then second, as the second wave wasn't there, first had ended, I got promoted as the district assistant civil surgeon, which is an administrative post. So now, during the second part of the COVID-19, as we call it, I was more into administration and managing the resources we have at our disposal. But since there were no medical specialists left with us, one guy left, I was the only one. So I had to double up as a medical specialist too. That I will give credit to my junior doctors. They did the real work in the wards, and I was there to assist them. During all these years of 1.5 years of our fight with COVID, there are many positives and negative stories. Positive stories is there are so many. I have not documented them, and memories fade as time goes by. So we have had a lot of positive stories. People coming in to us, the husband and wife, they both are positives. The small kid with them is a negative for COVID-19. How to handle the case? How to go? But there's nobody else to look after the kid. The staff at our hospital, they were so kind of helpful. They were bottle feeding the kid for themselves, and
wow.
It was really touching to see.
And Dr. Prabjeet, in these stories, I am assuming that you found your hope and strength, right? And was there any one experience, any moment where you were actually scared what's happening around you? Were there moments where you were like, okay, we are not going to be able to come out of this?
The scare was that as the number of cases were increasing day by day, the only scare we had was, will we have enough space to keep them? Will we have enough medicines to treat them? Will we have enough beds? That was the scare. The scare of getting infected or getting the disease ourselves, or the scare of dying of COVID, it never came to me.
Very interesting, sir.
Honestly, never came to me that I'll get what will happen if I get infected. That never came to me. Somehow I was away from that scare. The only scare I had was the only thing I was afraid of was that if I don't have enough resources, enough people, enough beds, then it's going to be tough for me.
Dr. Prabjeet, I run Stan Plus. I am the founder and CEO, and we are managing ambulance system and medical response for some of the largest hospitals in the country. And I remember at peak, I must have answered personally almost 300, 400 calls a day. I am wondering if this number was 5x or 6x for you, because I am assuming that you found it virtually impossible to split your personal and professional life for 3.5 months, starting March to end May, early June. So any advice that you have for your fellow health practitioners on what worked for you in keeping your sanity while everything around you was breaking apart?
So, as I always say, live in the present. What happened, nothing can be done about it. What is going to happen, we cannot foresee it. Brand new disease. Every day the guidelines are changing. Use this medicine or use that medicine. This medicine is going to be more helpful. The next day it would come out that it's not going to be helpful. So live in the present. Do the best you can do at the moment of time. This is moment of time. That's my mantra for my that works for me. Maybe it will help somebody else too.
Sir, and anything for the countrymen, anything for the citizens, because no one wants a wave 3. What are some of the good affirmations that we should give?
Pradeep, at the very beginning of the disease, as I talked with my fellow friends and my fellow doctors, there's one thing I had said to myself and to my friends, that we will win over COVID, no doubt about it. But we will never win over the stupidity. Sometimes people that comes with it. People have very false notions, and they have vague, very vague. They come with very wrong notions about the disease, about wearing masks, about getting vaccinated. They have very false impressions of all this. So
give us an example of something like that, so that we, in a very pointed way, can tell the citizens that when
they have to be educated in a big way. They have very wrong notions about the disease. They don't want to get vaccinated. People because I'm at a very rural kind of a setup, not big cities. People from rural areas come to me most of the times, and for example, there's an old lady comes to me and says, "I'll never get vaccinated." I said, "Why will you not get vaccinated?" Because she says, "I've heard they will give you the vaccine and you will die in 2 months. They want the old people to die." Then there's another old lady. She comes and she says she'll never get vaccinated. She'll never get sampled. She doesn't want to get herself sampled for COVID test, because they say that the government is going to make the test positive and then admit us to the hospital and then give us some injection and kill us. So the very negative thoughts are prevailing in the society. I wish we could do something about it, and more health education could be given to people.
So, Dr. Prabji, this is a great message to give to people around on this National Doctors Day. Our doctors, our clinical fraternity is standing shoulder to shoulder fighting this war. But without the help, without the support of an average citizen educating herself, educating himself, and trying to fight COVID first in their home, first through their behaviors, and then through the doctors, you cannot and we should not expect doctors to take all the burden. I think the burden of prevention, the burden of education, and the burden of the key preventive and hygiene aspects that we should not give up on, right? Wear a mask, sanitize your hands, and most importantly, vaccinate yourself the earliest that one can. I am very proudly vaccinated. I hope you are as well, sir. And I will wish that at the earliest, our entire country gets vaccinated, so that we don't have doctors like you who have to manage their personal life and professional life, worry about COVID because of stupidity or because of lack of education.
Right. True.
Thank you so much, Dr. Prabjeet, for being with us. And I salute you, and on behalf of the entire VOH team, on behalf of Viatris, on behalf of Stan Plus, and everyone who's listening, I salute you and your grit and determination, both during wave 1 and wave 2, in continuing to keep the spirit up, keep the chin up, and fight the disease. Thank you so much.
Thank you. Thank you. It was an honor being here.
Thank you,
Thank
sir.
you.
Good afternoon, everyone. Welcome to National Doctors Day Conclave, organized by Voice of Healthcare and powered by Viatris. I am the host for this session. My name is Prabdeep Singh, and I am CEO and co-founder at StanPlus. StanPlus is India's largest ambulance system. We run red ambulances as well, and we power the medical response system of some of India's largest hospitals and enterprises. I am extremely delighted today to have Dr. Arjun Dang with me. Dr. Arjun Dang is CEO of Dr. Dang's Lab, a chain of diagnostic labs in Delhi NCR. Dr. Arjun is a pathologist and specializes in liver pathology. Dr. Dang, first of all, thank you for being with us. I am very glad that you took time out of your busy schedule to be with us. But I'm also sure it's not as busy as it was 2 months ago. That time was terrible. How was it for you?
So firstly, Pradeep, very warm welcome to all our viewers. Very gracious thanks to VOH for having organized this on Doctor's Day, that is today. And also certainly I couldn't agree with you more there, Pradeep, that actually a few weeks back when Delhi had its second wave, actually in so many years of running the lab, and also it's been close to 4 decades that the company had been founded, we've actually never ever seen such tremendous amount of volumes coming in. And at the same time, Prab, if I'm actually truthful to you, it would have all been smooth if we had our entire team at work. Because obviously when our volumes were 3 times, and obviously you understand better than me being in the emergency service business, but with the patients having increased 3-fold and almost half our team having been infected with COVID, obviously those were the most difficult times. And I think improvisation was something that actually got us through. But if it actually lasted a few more weeks, I don't think the city would have survived. So I'm just glad that work is back to normal now.
Dr. Arjun, that's something that brings me to a question. You mentioned that we were running the business while we didn't have the people, right? And there was one more thing going on. We were also taking care of our families who themselves could be going through COVID, right? I know my parents were both infected and hospitalized in Chandigarh. They were in the hospital for almost a week. And I know how tough it was to balance running a business that is already low on resources, but all-time high on demand, and at the same time, taking care of the family. How was it for you? You've been in the thick of things, but how did you manage the work-life balance and separated your family and clinical life? Why don't you share your secret with our viewers here?
Sure. So, Prav, firstly, I'm very, very glad that your parents are doing fine. And I'm sure it must have been a very, very stressful time for you. But certainly with a work-life balance, we actually didn't have another way, and we had to strike the correct balance. Now, I remember that it was 6th of April last year, and we were the first ones in the country to actually set up a drive-through center. 6th of April actually happens to be my wife's birthday as well. And I had left the house at 6:45 in the morning to set up the drive-through because there was a lot of press coming in. There were a few patients who had booked for that day. There were a lot of regulatory authorities like the municipal corporation, etc., who wanted to come to inaugurate it. And all this was at a time when I used to tell people that, yes, this is going to be a drive-through testing service. And then they used to be like, what do you really mean by a drive-through testing service?
Yeah.
So actually, we've been through that entire stage where we actually didn't know anything about coronavirus to today when we are so much more knowledgeable as well. But obviously, it was always that we had to protect our family members as well because we were at high exposure. So it was little things like never entering the house with your shoes on, or the first thing that you do when you enter home is take a hot shower and then only try and meet anybody. Because obviously all of us live in joint families, so you have your elderly grandparents, your parents, your small children also. So I think it's more of that mental balance also that you need to actually inculcate, because there's so much stress at work that if you actually carry that stress back home, although I'm sure even in your work line, our phones never stop ringing. And I think it's a crime actually to put our phones on silent, because when our phones are on silent, you get dozens of missed calls. And by probably that time, someone could have been helped and you've actually missed the bus. So it's been stressful, but definitely all those long days and long nights are actually worth it when you get a nice WhatsApp message from a patient's family that yes, that the patient is doing better and that they couldn't have done it without your support. So it actually leaves a very warm and fuzzy feeling. And I think the family also understands that yes, you've really worked hard, but at the end of the day, I'm sure you agree, all the family really wants is that you at least keep yourself safe. And as long as that happens, I think if we come back home safe and help as many people as we can, I think we are really doing justice to the doctors community.
Dr. Arjun, that's amazing. I want to talk maybe a couple of minutes more on the drive-through. Actually, let's take a step back. When you talk to us about drive-through, talk to us about what does it take to, behind the scenes, do that test, right? Talk to us not only about drive-through, but talk to us as laymen. Even though we are healthcare practitioners, and I've gotten my COVID test done multiple times, I still don't know what happens before and what happens after. Why don't you tell us a story of what did it need to set that up, but also do educate us on the logistics of it.
Sure. So again, Pradeep, actually, there are very few people that I know who, until in this entire pandemic, have not got a COVID RT-PCR done. So obviously, it's something that everyone should know about. But actually, what was very challenging last April was that, again, lack of knowledge. We ourselves did not completely understand COVID-19 testing and the RT-PCR process. So actually, to set it up in the middle of complete lockdown in Delhi, I think that was actually the on-ground challenge, because you had simple tasks like, okay, like you want to print a simple banner or put up like a COVID testing booth, and there was absolutely no vendor that was available to do that. So I still remember that 2 days before starting up our drive-through, we actually had a printer at home and one in the office. So we actually did some printing, and my team was doing that because there was no professional printer that was open. Now, during lockdown, how do you actually make a drive-through function? Because everyone who's actually leaving their house, the cops are stopping them and telling them that pay a fine. So actually, to actually arrange those curfew passes as well, to have a completely contactless system in place so that people can make an online booking, come at a particular time slot, the technician there is changing their PPE and gloves properly, there's only sign language that's being used, because obviously we try to minimize interaction and everything, and then also give reports within 12 hours for every single drive-through. So till day, all our drive-throughs, the reason that we haven't scaled it up to that extent is because I always wanted to calibrate the turnaround time of reports with the volumes that I'm doing, because I'm a firm believer that it's very easy to collect thousands and thousands of samples, but then actually to get a good report out without compromising on the quality within 12 hours is actually what is really benefiting the patient. So again, to organize that entire drive-through, get all the regulatory permissions, educate our staff, train our staff, and also give patients that ease, comfort, and enhancing their experience was actually at the helm of all our priorities. And I'm glad that we were the pioneers in that. And today there are, I think, more than 100 labs that are actually operating drive-throughs all over the country.
That's amazing. It's a bittersweet feeling when something you initiated scales up. You're happy that it has, but sometimes you're sad that you weren't doing it. So, Dr. Arjun, thank you for doing that for the country, because I'm sure it has enabled far more people to be tested and diagnosed. Delhi was carnage. It was really tough. I live in Hyderabad. I operate our business in south and west of the country, and the number of calls that I was getting for help in Delhi was, that number was staggering. And I can only imagine what happened in Delhi and how the citizens of Delhi felt. Was there any moment where you were like, oh, you're scared for your family, you were scared for your business, and tell us a story about that. Do you remember a day where everything was very grim?
Yes, so certainly there is one particular late night where my phone is never on silent, and especially during the second wave, it was never. I usually keep two numbers because you do understand that there's one work phone that doesn't stop ringing, and there's another phone that you usually give to important people who actually can reach you in an emergency. So at night, the few hours of sleep that I was getting, I had that important phone on loud. And I got a call from one of my staff members who's been with us for close to 30 years. And I could just hear him sobbing on the phone and saying that my father's oxygen levels are suddenly dropping, sir, and I need an oxygen cylinder. It was 1:45 at night. The place where his father was about 90 kilometers from where I live. And this was when oxygen was actually like diamonds, and you couldn't source it even when you wanted to. So at that point of time, the next 2 hours, the number of calls I made just to arrange that oxygen cylinder and the amount I paid is not even relevant. But then just those 2 hours, actually me thinking out to myself that I'm a healthcare practitioner in the center of the capital of the country, and I actually needed for someone so close. And still, I've made 25 phone calls and contacted 100 people. But in the end, with God's grace, we did manage to scrimmage half a cylinder, get the night through, and then we got a concentrator the next morning. But certainly, that was actually reality sinking in, because it was like even being a doctor and even helping hundreds of people every day, still when I really require something or someone so close requires something, it was actually really shocking. But then I'm glad that the city has seen the worst days, and now people are obviously more educated, more aware, and I'm keeping my fingers crossed that they do continue to practice all COVID appropriate behavior and we can avoid this third impending wave also.
Absolutely. And the more this happened, right, the supply chain got disrupted, we started getting calls for all kinds of things. And I, as an ambulance operator, always used to take a simple instrument, a simple equipment, which is the oxygen regulator, for granted, and you realize the importance of the healthcare supply chain during these times. And Viatris is, this forum is sponsored or powered by Viatris. And when I was speaking to them, I realized that, how much they had to scale up their production of remdesivir or liposomal amphotericin B. And we all had to do that while taking care of our employees, right? And the example that you gave, not only were you thinking of your customers, we all were thinking of our employees as well. So with wave 3 being predicted, I don't know, I wish it's not as severe as wave 2, and I hope that we fizzle out the waves from here on. I wanted you to give the healthcare workers at large a message. And Dr. Arjun, this message is very important because a lot of people that I spoke to by the end of the wave were motivationally very low, right? And not because they didn't get the credit, but I think people have seen too much loss around them. And I think that it is important for us to acknowledge the role that all of us, all our stakeholders, all our employees, but increasingly everyone who's part of the pharmaceuticals, biomedicals, diagnostics, right? Healthcare, hospitals, each and every participant, they've played a role. I wanted you to give the frontline workers, the healthcare workers, the students who are part of the healthcare industry a message.
Sure. So very relevant, keeping our fingers crossed that we don't have to face this third wave. I feel that the third wave will happen, unfortunately, in some fashion or the other. I'm just hoping that it's very mild. But the main thing that we have to actually keep in notice, and I know everyone has been through such tragedies that we are all on very low motivational levels. But I feel that we need to do this for our future generations. Because I feel that our age group, that is the younger doctors from the ages of probably 25 to maybe 35, we are obviously at lesser risk. And we are also, in that sense, more attentive in the way that we can certainly take more precautions, and we can obviously give the best to our patients. So this goes out to all the young doctors out there. And I basically want to say that, yes, do not give up. Think of the future generations. Think of the elderly that you have at home, because no one is safe until everyone is safe. And that does strike a chord. And moving forward, I would feel that, yes, we have to stay together, especially the youngsters, if we have to pull this one off.
Amazing. Dr. Dang, it's been a great pleasure having you here, hearing from you how you set up the first drive-through testing, hearing from you how you helped so many people during the peak, and at the same time, you never let that spirit of helping your employees, your business, your customers, phenomenal. And from one entrepreneur to another, from one leader to another, but also from the entire medical fraternity, from the entire viewers of this forum, I wanted to express my heartfelt gratitude for your contribution. Thank you so much, and wishing a great National Doctors Day from all of us to you.
Thank you, Pradeep. Thank you for your kind words, and grateful to you and VOH for having organized this. Thank you.